Hola, buenos días.
Good morning, everyone. Let's get started this very important meeting. If you'd be so kind as to take your seats. Thank you. Good morning and welcome to Washington. Before starting, we are still having our building remodeled. We're here at the hotel. We have some security announcements, and then we will resume, or get started, rather.
The speaker's not using a microphone? Of course.
Good morning, everybody. Sorry about that. For the emergency procedures here in the building, there are going to be two exits that you'll be looking to leave the building from. One of them will be here on my right-hand side. Exit through these doors, up the stairs. You will egress outside of the building from there. Alternatively, out these doors, go up the stairs through the main lobby, and you can egress out through the main entrance of the building. Thank you again. Please enjoy your meetings. If there's anything else you need, please don't hesitate to come see us at the front desk. Have great meetings. Thank you.
Thank you very much. Bueno,
Before starting, as many of you already know, we had some difficulties yesterday. Storms in Florida, and the airport in Washington was also shut down because of a radar glitch. So some colleagues are going to be arriving late, perhaps today or worse yet, tomorrow. We hope today. One is the Minister Christopher Tafton of Jamaica, Minister of Health, who is the president of the Executive Committee. So Dr. Marimon, the Vice Minister of Health from Cuba, is with us, and he has offered kindly to preside over the session until our president arrives from Jamaica. So you will see him at the head table, and he will open the session. Thank you.
Buenos días a todas y a
Good morning, everyone. It's an honor for us to preside over this meeting, Executive Committee. I would like to welcome all of the members of the committee and all of the observers of this 172nd session of the Executive Committee. As has already been explained, the President Minister of Health of Jamaica was not able to arrive. Hopefully he will be here by tomorrow early, so he will be able to take on his role as president of this executive committee. In the meanwhile, I will stand in for him. 8 members of the executive committee are present in the room, and we therefore have a quorum, and the session is called to order. The members of the executive committee are Argentina, Bolivia, Brazil, Chile, Cuba, United States, Suriname, and Uruguay. Other members taking part are Canada, Ecuador, Spain, El Salvador, France, Guatemala, Haiti, Mexico, Nicaragua, Panama, and the Dominican Republic. Thus far, and if I overlooked anyone, we will make that correction later. It's a challenge to preside over this meeting, given that it was an unforeseeable circumstance that the Minister of Health of Jamaica had not been able to arrive. I will do my best, put my best foot forward, and I hopefully will account on all of you, or on the assistance of you. Now, I would like to yield the floor to the Director of the Pan American Health Organization, Dr. Jarvis Barbosa.
Muchas gracias.
Thank you very much, Mr. President.
Bom dia. Welcome to Washington, to our meeting. Honorable Chairperson, distinguished members of the Executive Committee, Excellencies, colleagues, ladies and gentlemen. It's an honor to open the 172nd session of the Pan American Health Organization's Executive Committee. PAHO is grateful for the continued partnership of its member states, and I want to thank the Executive Committee in advance for your insights and guidance over the next few days. I began my tenure as director nearly 5 months ago, during 2 active public health emergencies of international concern, including an unprecedented global pandemic. The COVID-19 emergency is now formally over, but its impact remains and will influence our region's public health agenda for years to come. PAHO has been working diligently to continue to protect our people and speed the region's recovery from the pandemic. Equal energy has been given to addressing the myriad other health priorities that fell off track while the world responded to the emergency. The risk of vaccine-preventable diseases is at an all-time high, and there is an urgent need to increase surveillance and immunization coverage. It is critical that we improve maternal, neonatal, and child health indicators and address the rising burden of non-communicable diseases, including mental health conditions. Climate-driven threats, such as extreme weather events and the spread of disease vectors, pose additional risks and will grow more acute as we enter the heart of hurricane season. And yet, I am more confident than ever in our region's ability to respond. The pandemic put the Americas to the test, but it also revealed what is possible when we work as a collective and make public health our highest priority. The efforts and investments of our member states saved lives, increased the access to essential tools, and helped address critical gaps in our health systems. The urgency, innovation, and solidarity we employ to overcome COVID-19 should not be reserved only for times of emergency. As director, I want to bring the same urgency and innovation approach to addressing our most pressing health challenges and to ensuring equitable access to health care for everyone in the Americas. When I took office, I framed my vision for PAHO around 5 pillars. Today, I want to revisit these pillars and share some of the progress we've made in each one of them so far. The first pillar is to contribute to end the pandemic with the best tools we have on hand. While COVID-19 is no longer an emergency, it remains a public health priority. We must continue to work collectively to track its spread, expand the access to vaccine boosters, and respond swiftly to surges to spare our population the worst consequences of the virus. I'm proud that our region continues to report some of the highest COVID-19 vaccination coverage in the world. PAHO will continue to make vaccines available for boosters and as a resource to control outbreaks. We have also taken innovative approaches to reach vulnerable populations, not only in response to COVID-19, but also Mpox. Recently, PAHO partnered with the social networking app, Grindr, to tackle misinformation about monkeypox and better reach LGBTQI+ populations with accurate information and care. And we have strengthened our surveillance capacity across the region, including genomic surveillance. An important challenge for us moving forward will be to sustain this robust integrated network so that we are able to sound the alarm when infectious diseases like COVID, Mpox, Zika, and others arise. Which brings me to the second pillar, applying the lessons learned from the pandemic. COVID-19 had an enormous impact in our region. It also had a profound effect on PAHO. Confronting a public health emergency of such scale yielded valuable technical and institutional lessons which we are using to improve our efficiency and magnify our public health impact. For the first time, PAHO has released the report of an external evaluation, the report on the evaluation of PAHO's response to COVID-19. We are the first WHO regional office to conduct such a review, and this reflects our strong commitment to learn and evolve. One key lesson is that in a global emergency, it is imperative for the region not to lose focus on existing health priorities, such as childhood vaccination. With that in mind, I have made increasing vaccine coverage a top priority of the organization and have expanded and strengthened PAHO's immunization regional program to meet member states' need for more technical support. PAHO has supported the participation of our member states in the global debate about the new instrument to respond to pandemics and the changes in the international health regulations. Several virtual meetings have been organized so far, and the second face-to-face meeting will happen in July. These are crucial and unique opportunities to guarantee that the world will be better prepared with equitable access to vaccines, medicines, and medical products. We have also supported our countries to present proposals to the Pandemic Fund, and we will work with them in the implementation of the projects aiming to strengthen the national capacities in every country in the Americas. The global COVID-19 vaccine rollout made it clear that we must build up medical manufacturing capacity in Latin America and the Caribbean. These efforts will also help us better address the urgent need for essential medicines, routine immunizations, and diagnostics in our region. We are continuing to strengthen the regional platform on access and innovation for health technologies, a PAHO WHO collaborative project that is facilitating technology transfer and boosting regional production of mRNA vaccines in Brazil and Argentina, and starting to support the other projects. Let me now switch to Spanish, Mr. Chair.
And this brings me to the third pillar to ensure timely and equitable access to innovations on health. I am rekindling the PAHO Initiative for Disease Elimination, an ambitious plan whose objective is to eliminate 30 communicable diseases in the region of the Americas by 2030. That effort that will call for a firm political and financial commitment by all our member states offers the possibility of saving and improving millions of lives and achieving once again our target that PAHO will be an example on innovation for the world in the field of public health. It is possible to attain these ambitious targets if we have the ability to quickly transform the successful demonstration projects that we have in the region into health policies that become part of primary health care. New technologies that are already available in order to identify HPV in women can save thousands of lives of women from vulnerable groups that currently die because of cervical cancer. The quickest inclusion of screening, diagnosis, and treatment for non-communicable diseases in primary health care can reduce 30% of premature and avoidable, preventable deaths because of these causes that we have in the region. To expedite the introduction of PrEP in more vulnerable groups can significantly reduce the spread of HIV. This and others new strategies, technologies, and initiatives can turn the region into complying with the elimination goals in an equitable fashion. And in order to further support this process, we've introduced changes into the organization structure of PAHO in order to reposition technical cooperation in the elimination and to expedite the process for the procurement of new vaccines, medicines, and lab tests so that we can provide service to our member states in a more efficient way. The fourth pillar, to create resilient health systems based on primary health care, has also been an area of special interest. Primary health care is used as a point of entry to the health system, and this is our first line of defense in order to detect disease outbreaks and other emerging health challenges. Health providers and primary health care offices are the first in treating a child with measles, diagnose a patient with RSV, or to report a concerning increase in the number of dengue cases. The communities depend on these health workers so that they can advise them on issues such as family planning, non-communicable chronic diseases, as well as mental health problems. The strengthening of primary health care systems is a priority for PAHO, which we support through technical guidance and stepping up the capacity of our member states. As part of this work, we recently published the report by the High-Level Commission on Mental Health and COVID-19, an initiative that was set in motion by my predecessor, Dr. Carissa Etienne. It is a pleasure for me to continue with this important agenda, and I will ensure that the recommendations of the report will urgently be enforced. PAHO is expanding its promotion work in order to deal with the growing impact of non-communicable diseases in our region. At the beginning of this month, I participated in the Ministerial Conference of Small Island States on NCDs and mental health, organized jointly by Barbados and WHO. Recommendations emerged from that meeting, such as, for example, strengthening a regulation of processed food in order to control NCDs, a measure which I believe is of critical importance and ought to become a priority for countries in our region. Last but not least, the fifth pillar has to do with strengthening PAHO's capacity in order to support member states. I've invested a lot in the fifth pillar during the first months of my mandate, because I believe that a stronger PAHO contributes to achieving a safer, healthier, and more equitable region. In order to promote progress in this area, I've set in motion a new initiative called PAHO Ahead, so that the organization will be better equipped in order to face public health challenges in a more effective way with transparency and accountability. Let me give you some examples of changes that we've already undertaken. In order to increase efficiency in a post-COVID world, we've optimized the organization structure of PAHO with the purpose of responding more speedily to the more urgent challenges in our region, not only public health emergencies, but also outbreaks of infectious diseases, extreme meteorological phenomena caused by climate change, as well as the growing burden of non-communicable diseases. We've also decentralized decision-making processes with the aim of granting more authority to our representatives in the countries so that PAHO offices, country offices, will swiftly respond to the needs of member states. In order to increase our transparency, we've undertaken a commitment in order to publish all external evaluations, such as the aforementioned report about the evaluation of the response of PAHO to COVID-19. They will also be available and made available to member states, all internal audit reports of the organization. We're also undergoing the process of strengthening prevention and response procedures to all forms of harassment in the organization and the persons who we serve, including sexual abuse and exploitation. With this initiative, PAHO Ahead will be stronger and more efficient when facing major challenges for today's and tomorrow's health. Mr. President, distinguished members of the Executive Committee, distinguished observers, With a view to the future, I am very aware of the complex gamut of challenges posed to health as faced by the region of the Americas. This meeting of the Executive Committee provides a valuable platform in order to give a new approach to the organization to deal with these challenges and ultimately to improve health results throughout the region. Here we are to take on important administrative and managerial issues of Bajo, with a budget program for the upcoming biennium, the financial situation, the reports by auditors, and so many others. We're also going to review the new priorities of technical cooperation on issues such as prevention and control of non-communicable diseases in children, adolescents, and young people. The strategy in order to strengthen human resources and health within the framework of attaining resilient health systems, strategic communication in public health for a change in behavior, mental health, and suicide prevention, amongst others. To conclude, I'd like to leave with you the following reminder. Our organization was born with the idea of Pan-Americanism. In fact, this concept is part of our name. It means that we're stronger when we work together, and we are more effective and efficient when we go after our objectives with one common voice and purpose. The power of Pan-Americanism is as powerful today as it was over a century ago, and I believe that this is one of the keys in order to build a more brilliant and healthier future for our region. This means that we ought to work together hand in hand with the purpose of promoting sound investments in national health agencies so that public health will continue to be a political priority for all member states, especially now that the pandemic is over. At a global level, we ought to exert collective pressure so that the region of the Americas will become a leader in innovation in the field of public health and will play a more outstanding role in the configuration of the World Health Agenda. Thus, we will be able to ensure that we will meet the unique needs of our peoples and communities. But above all, Pan-Americanism reflects our unwavering commitment with equity and health. Therefore, we ought to continue being tireless in our search for universal access to health and our coverage so that all the people, families, and communities in the region of the Americas will have the same opportunities to live a healthy life. Thank you very much, Mr. President.
Gracias, Director.
Thank you, Director. I now wish to give the floor to Mrs. Mary Lou Valdez, Deputy Director of the Pan American Sanitary Bureau, who, in her role as Secretary of this 172nd session of the Executive Committee, will make some announcements.
Gracias, Señor Presidente.
Thank you, Mr. President.
Bear with me, I have a few announcements. In accordance with Rule 49 of the Rules of Procedure of the Executive Committee, the working languages shall be those of the members of the committee. Therefore, interpretation is being provided in English, Portuguese, and Spanish. You can request the floor by placing your country tag vertically. Delegates are asked to give their name and their country each time they take the floor. This will facilitate the official record keeping of the interventions. Members of the Executive Committee will be recognized before other member states that are participating as observers. As usual, member states are asked to limit their interventions to 3 minutes. A traffic light system will help delegates keep track of time during your interventions. At the start of the intervention, the traffic light in the room will be green and will remain so for 2 minutes. It will then change to orange, indicating that 1 minute remains in the allotted time for your intervention, and then red when the time is over. We would like to remind delegates to send their interventions to gbo@paho.org. This will help with the preparation of the final report of the meeting. Please ensure that each intervention includes the name of your country and the corresponding agenda item number. Access to documents, daily programs, and updates during the session of the Executive Committee are available on the PAHO webpage and through the PAHO Governing Bodies app. You can download the app to your laptop or smartphone, and you are please encouraged to use it. I would like to announce that the Executive Committee members will be receiving an envelope including information on the PAHO Award for Health Services Management and Leadership 2023 candidates. If any member state participating as an observer would like to receive this information, kindly let the Office of Governing Bodies know. A commemorative photo of the Executive Committee participants will be taken at 12:30 today, and we'll let you know where because we're watching the weather. But it'll happen at 12:30 as soon as the meeting breaks for lunch. Right after the official photo, the members of the committee of the PAHO Award for Health Services. Okay.
Sorry.
That's okay.
Yeah.
Going on, skip that one. This evening at 6 p.m., our director, Dr. Jarvis Barbosa, will host a reception in honor of the participants of the Executive Committee. And this reception right now is planned for the courtyard. On Wednesday, June 28th, a briefing session about the PAHO COVID response evaluation is planned to take place in this room during the lunch break. That's Wednesday, June 28th. At that time, lunch will be provided to the delegates who are attending this briefing. Thank you, Mr. President.
Gracias, secretario.
Thank you, Secretary. And so now we move on to the next agenda item, and that is item 2.1, adoption of the agenda and program of meetings. I would like to bring to the attention of the Executive Committee the following documents. Document CE 172/1 and CE 172/WP, and I ask the Secretary, Ms. Mary Lou Valdez, to introduce this agenda item.
Señor Presidente.
Thank you, Mr. President.
In accordance with Rule 9 of the Rules of Procedure, the Executive Committee shall adopt its own agenda, and in doing so, may make such additions or modifications to the provisional agenda as it may wish, in accordance with these rules. Gracias, señor Presidente.
Continuamos.
So let us proceed. And now I give the floor to the plenary. Floor is open for any comments.
No hay objeción.
There seems to be no objection, and so we take the agenda for the meeting as adopted. And now please allow me to bring to your attention the preliminary program of meetings. Madam Secretary, I would be very grateful if you could introduce this proposal.
Gracias. In accordance with Rule 54 of the Rules of Procedure of the Executive Committee, the committee shall be represented at sessions of the council by 2 representatives appointed by the committee from among its members. The committee may designate alternates in the event that either of the representatives is unable to attend the pertinent session of the council. Of the committee. The representatives of the committee shall be responsible for making appropriate reports on the actions and discussions of the committee containing such information as may be useful to the deliberations of the council. Gracias, señor Presidente.
concedo igualmente la palabra al plenario.
Floor is open for comments. There seems to be no objection, and so we take the preliminary program of meetings as adopted. Let us now move on to the next one. And so now we are moving on to agenda item 3.1, report on the 17th session of the Subcommittee on Program, Budget, and Administration. I bring to the attention of the committee document 172/4, and I invite Mr. Miguel Rodriguez, delegate from the Dominican Republic, the country that chaired the session of the Subcommittee on Program, Budget, and Administration that was held from 22nd to 23rd March 2023. That is to say, the 17th session, to introduce this report. Thank you very much, Mr. President, and thank you for this opportunity, and greetings to the head table. Please allow me to read the report of the 17th session of the Subcommittee on Program, Budget, and Administration. It is an honor for me to report on the activities of the Subcommittee on Program, Budget, and Administration that held its 17th session on the 22nd and 23rd of March this year. The session was held at the building of the General Secretariat of the Organization of American States in Washington, D.C., since the conference rooms of the Bajo building of Bajo's headquarters were being renovated. Present in that session, we had delegates of the following members of the subcommittee. They were elected by the executive committee or designated by the director. And the countries were the following: Argentina, Brazil, the USA, Honduras, Jamaica, Dominican Republic, St. Kitts and Nevis. As observers, we had the delegates of Antigua and Barbuda, the plurinational state of Bolivia, Canada, Mexico, and Spain. My country, the Dominican Republic, was elected to chair the subcommittee. St. Kitts and Nevis was elected to be the vice chair, and Argentina to be the rapporteur. The subcommittee covered important financial, administrative matters as well as others. Amongst these, the program budget of the Pan American Health Organization 2024-2025, the scale of assessments for 2024-2025, as well as the financial report by the director corresponding to 2022. Likewise, the subcommittee also reviewed the report on management of human resources, the situation with the Master Fund of Capital Investment, as well as the amendments to the Latin American Center of Latin America and the Caribbean on Information on Health Sciences, BIREME, and its bylaws. The points covered by the subcommittee appear in the agenda for this session of the Executive Committee. I will report on each one of these items as they will come up in our agenda. With this, I conclude this part of the report. Thank you very much, Mr. President.
Gracias.
Thank you. Floor is open for comments.
Por favor, Brasil.
Please, Brazil has the floor. Thank you very much, Mr. President. Brazil would like to thank the delegate for presenting this report on the Subcommittee on Program Budget and Administration, as well as the information on COVID for sustainable basic information. We believe that the redefinition of priorities is very much in line with the need for promoting sustainable progress for universal health. It seems to us that the resources stemming from the World Health Organization are essential for the good functioning of the Pan American Health Organization. The total budgetary allocation proposed by WHO for the regional office for the Americas is 313.7 million for 2024-2025. In connection with 2022-2023, we would have an increase of 3.5 million, or 1.6% for base programs. With all that, we have to point out that this amount is far from the growth or the increase of 20% in the set contributions as proposed in the budget for WHO programs for the upcoming biennium. We reaffirm the importance of WHO transfers for base programs that account for 42% of the total number of resources. We still see that the participation of the region in the budgetary allocation of WHO has increased significantly in the 5 previous biennia. The level of financing that the region received in practice did not grow in that same proportion. In general terms, the Americas received close to 25% less of what is provided in the budget. We greet the efforts provided for by PAHO to reduce the cost, to be more efficient, to improve priorities, and improve governance and transparency in line with what is proposed by WHO. With all that, we acknowledge that these reports do not offset the lack of proportion of the programs as compared with other regions. Last but not least, we reiterate our full commitment with our financial contributions in the same scenario of fiscal restriction. Recently, we covered the payment of our contribution for 2022. Thank you very much.
Gracias.
Thank you very much, Brazil. We take note and we recommend that we deal with this issue when we come to the item on budget 4.1. Very well. Any additional comment? Should there be none? Yes? I apologize. Please go ahead, sir.
Thank you.
Madam.
The United States appreciates the comprehensive report on the 17th session of the Subcommittee on Program Budget and Administration and the Dominican Republic's efficient and effective chairing of the meeting. We note the Bureau's technical achievements in 2022, including the provision of political, technical, and strategic guidance during the COVID pandemic response. We thank the Bureau for its ability to be nimble and explore ways to increase efficiency. We also appreciate PAHO's transparency in reporting on its expedient and efficient use of the $75 million voluntary contribution from the United States to strengthen COVID-19 surveillance and vaccine capacity, bolster other critical systems under stress from the pandemic, and strengthen health systems while building resilience in the region. Looking at lessons learned, we are wondering whether the Bureau has identified any areas of focus that can be merged or reduced in order to further increase efficiency based on the prioritization exercise launched last November and input from member states that helped inform the proposed program and budget. Also, regarding the move of Equity, Gender, Human Rights, and Cultural Diversity Unit from the Deputy Director's Office back to the Assistant Director's Office, we would appreciate the Bureau sharing additional information on how this move will better ensure closer integration of gender and equity across technical programs. Finally, we thank you for the update on the recruitment of staff to oversee the implementation of the policy on sexual exploitation and abuse. And we would appreciate the Bureau providing additional information on measures the Bureau is considering to further strengthen gender parity and reduce and respond to incidents of sexual abuse and exploitation. We understand that these issues may be further addressed in the agenda, and we are fine with responses being provided at that time as well. Thank you.
Bien, bueno, ustedes ven,
Very well. As you can see, I need some help here. I would be very grateful if you could let us know what these points are, those points that would have to be considered.
ya, podemos tomar nota.
We can take note and then please deliver the items that you'd like to have discussed when we come to the relevant items of the agenda. Is that okay? Good. Any additional comments? I don't know whether the chairperson of the subcommittee has any additional comments to make. Distinguished Director, do you have any comments? Yes, thank you, Mr. President. First of all, I'd like to thank all the members of this subcommittee on program budget and administration in the Dominican Republic in particular that acted as a chairperson of the subcommittee. We had a meeting that was very productive, and this is a subcommittee that greatly facilitates the work itself of the executive committee. So I'd like to thank each and every one of the participants of our subcommittee on program budget and administration. I would also like to thank Brazil for his statement. It seems to me that the participation of our member states at the World Health Assembly in all the debates on the budget draws our attention for a need for a more equitable distribution of the resources of WHO, and that is quite important. We're now undergoing a process of conversations with our colleagues in Geneva by presenting a proposal for our region of this initiative on strengthening the presence of WHO in our countries. So we've already submitted one first version. We asked Geneva, just like the other regional directors have done, they requested the same. We also requested an additional flexibility because the categories of countries that was established is not the most adequate in our mind because there are different situations in countries in the different regions, but we have the commitment that this new resource is used directly to support our presence in the countries with a priority for the most vulnerable countries in the region. So I'm very grateful for the very active participation by countries in the region in this debate, which I believe is a very important debate.
Delegation for this very important committee. Last week we had a meeting to present the report about this very generous donation that the U.S. government made last year. 75 million that were used to strengthen many important aspects in our region, not only to improve the response to COVID-19 pandemic, but also some initiatives that will be a very important legacy to strengthen the health system resilience in our region. For instance, we strengthen cold chain capacity in many vulnerable countries in the region that will be very important to keep the immunization, routine immunization programs in these countries. We expanded the access for telemedicine in some rural areas in vulnerable countries that also will be a very important platform for non-communicable diseases, mental health, communicable diseases, at the primary health care. We also had many other initiatives that I will not go one by one, but that this report is available to all member states, and I think that
including member states, participating states, and assessed members. 13 have paid their assessed contributions in full. 6 have made partial payments. However, 23 have not made any payments towards their 2023 assessed contributions. One member state owes assessed contributions since 2017, Venezuela. This member state is in arrears such that it is subject to Article 6B of the Constitution of the Pan-American Health Organization. It has arrears totaling $14.5 million in assessed contributions. As of May 31, the organization had to access $32.3 million from the Working Capital Fund in order to meet commitments of the assessed contribution budget. The organization looks forward to receiving the balance of assessed contributions in a timely manner in order to implement fully the biennial program of work as approved by the member states. Thank you. And just to point, as we see in the chart, the last column, which presents 2023 contributions, of course, it's partial, and the due balance, it's 115 million. Just to note that we have received 15 million as of now. If we compare it with the same period of the previous year, we have received 74 million as of May, June 2022. Thank you.
Thank you, Director. We open the floor for anyone's comments.
No hay intervención.
There are no requests for the floor. Mr. Director, do you have any comments?
I was hoping that many member states would say, okay, we are paying our first contribution next week or this week, but no, it's, I think just to first to thank the countries that have already made the payments. I think that's very important because we know that many countries are still facing the challenges that were posed by the COVID-19 pandemic. Now we know that COVID-19 pandemic was not only a public health drama for our countries, but also we had in many countries suffering important social and economic impact. So I think that is important to recognize. For this reason, the countries that have already made their payments, I want to really thank them, and also to encourage all the other countries to make their contributions. I think that our Director of Planning, Budget and Evaluation will remind you that we have not seen an increase in the assessed contributions since 2012. So in real money, when we discounted the inflation of this period, we have a reduction in $50 million. So I think that this is a clear evidence that we are providing more efficiencies to the organization. But I also want to remind you that the funds that we received during the COVID-19, the emergency funds, are decreasing now. So probably we will rely more this year and next biennium in the assessing contribution than we had to rely in the last biennium. So I want to encourage you all, despite all the situation that we have, to clearly make the payment of the assessed contribution. Thank you in advance for that.
Gracias, director. Bueno.
Thank you, Mr. Director. We would ask the rapporteur now to present the draft resolution. Thank you, Mr. Chairman. We greet Director Barbosa and all of the members of the Directing Board and observers. Draft resolution, report of the collection of assessed contributions, 172nd session of the Executive Committee. Having considered the report, of the collection of assessed contributions, document CE 172/18, and addendum 1, presented by the director. PP2. Noting the current financial stress the Pan American Health Organization is facing as a result of the delay in receipt of assessed contributions. PP3. Noting that the Bolivarian Republic of Venezuela is in arrears in the payment of its assessed contributions to the extent that it is subject to the application of Article 6B of the Constitution of the Pan American Health Organization. PP4. Noting that as of
No han efectuado pago alguno.
June 2023, member states have not made any of the payments toward their 2023 assessments. Resolves OP1 to take note of the report of the collection of assessed contributions, document CE 172/18, addendum 1, presented by the director. OP2 to commend the member states for their commitment in meeting their financial obligations to the organization by making efforts to pay their outstanding arrears of contributions. OP3 to thank the member states that have already made payments for 2023. OP4 to strongly urge the other member states to pay all their outstanding contributions as soon as possible to mitigate any impact on technical cooperation activities. OP5 to request the director to continue to inform member states of any balances due and to report to the 60th Directing Council on the status of the collection of assessed contributions. That concludes the report or the draft resolution. We give the floor to the plenary if anyone would like to speak.
Sí. Por allá, por favor. Salvador.
El Salvador, please. Good morning. On behalf of El Salvador, we would like to thank the director for all of the support that we have received from PAHO ever since you took office as the director. I'd also comment that we held a meeting with the Council of Ministers of Central America recently, and with our colleague of the Dominican Republic, and together we agreed that we have seen a change in that the use of funds has been more efficient and the strategy adopted of late in our country. So the comment was simply by way of thanking the director for that and to urge other member states to make an efficient use of your local offices, because our personal experience is that we have a much closer working relationship than in past years with the arrival of the new director, and that is something that I think benefits all of our populations. Thank you. Thank you, El Salvador. Is there any other intervention? There not being any objections, then this draft resolution is hereby approved.
Ya, entonces ahora, según el orden del día.
According to our order of business, it's time for our coffee break. We will resume with the next item, which is 4.3, which we will take up after our coffee break. 20-minute coffee break. Thank you.
Bien, continuamos.
Very well. Let us continue with renewed strength after the recess. And now we move on to the next item on the agenda. That is item 4.3, Policy on the Health Workforce 2030, Strengthening Human Resources for Health to Achieve Resilient Health Systems. I bring it to the attention of the committee, document CE 172/14, and I call on Dr. James Fitzgerald, Director of the Health Systems and Services Department of the Pan American Sanitary Bureau, to please come up to the head table to introduce this agenda item.
Thank you very much, Mr. President. Honourable President, delegates to the 172nd Executive Committee, Director Dr. Barbosa, a well-trained, qualified and equitably distributed health workforce proved to be central to the response to COVID-19. As the region begins to emerge from the pandemic, strengthening the health workforce remains crucial to building resilient health systems that can respond better to future health needs, addressing health threats and supporting ongoing efforts towards social and economic recovery. The policy proposal presented here today before the Executive Committee examines lessons learned in health workforce issues during the COVID-19 pandemic. It presents policy options to address critical and long-standing systemic deficiencies in health workforce throughout the Americas, as well as opportunities to address newer and more immediate challenges that have directly arisen as a consequence of the pandemic, not least health workforce retention, mobility, and migration. The Policy on Health Workforce 2030 reflects the priority the countries are now affording in human resource for health. It has been developed building off existing regional strategies and plans of actions approved by the Member States, including the Strategy and Plan of Action on Human Resources for Universal Access to Health and Universal Health Coverage 2017-2018, and the 2021 Strategy for Building Resilient Health Systems and Post-COVID-19 Recovery to Sustain and Protect Public Health Gains. This policy document proposes 5 strategic lines of action, taking into account differing national contexts, needs, vulnerabilities, and priorities. The 5 priority policy actions proposed are to strengthen the governance and promote national policies and plans for human resource for health, to develop and consolidate regulatory mechanisms for human resources for health, to strengthen the formation of multidisciplinary teams within integrated health service delivery networks based on primary health care, to enhance and strengthen capacity building for the health workforce to address health priorities and for improved preparedness and response to public health emergencies. And finally, to promote decent working conditions and physical and mental protections for health personnel to support the recruitment and retainment of the health workforce. We would like to thank all Member States that have contributed to the development of this policy document and for their participation, comments and contributions made during the consultation process. Thank you, Mr. President.
Bien, a continuación.
Now, floor is open for comments. Any requests for the floor?
Nadie.
There seems to be none. None.
Brasil.
Brazil is asking for the floor. I apologize, I couldn't see you. Thank you. Thank you very much, Mr. President. First of all, I wanted to thank the Secretariat for the document presented on the policy on the health workforce for 2030, strengthening human resources for health to achieve resilient health systems. We would like to thank for the consultation process that was followed, which enabled us to have a sounder and more representative statement reflecting the positions of the member countries. We would like to ask for some clarifications. from the Secretariat in connection with the content of the report. First of all, the report mentions the engagement of PAHO in the America's Health Corps, which is a very interesting and important addition. We would like to ask what has been done, what was done, and what has to do PAHO's Secretariat in order to promote that involvement. The second query that I would address has to do with the report, the financial and administrative impact that appears in Annex C. And specifically, I would like to know whether it is possible to specify how much of the $1 million, additional $24.9 million in additional resources, that is to say voluntary contributions from other sources, would participate. And secondly, what is the breakdown of the training that is being foreseen? For what health professionals is this to be addressed, and in what regions of the Americas? And ultimately, how the Secretariat has a plan to deal with all these issues. And this obviously does not prevent us from agreeing with the approval of the resolution as it is contained in Annex B. Thank you.
Gracias, Brasil.
Thank you, Brazil. Argentina, please. Thank you, sir. We're very grateful to the organization for the consultation held on the Policy on the Health Workforce 2030, where we've participated in due course. We're aware of the impact of the pandemic in the provision and the quality of health services and the gap that exists between demand and supply of health personnel all over the world. Likewise, we believe that we have to expedite investments in education, skills, and employment for health personnel in order to achieve universal health care and coverage. We stress out the importance of having a human approach dealing with health personnel and the empowerment of women. We also agree with the 5 strategic lines of actions that are proposed in the document, and within this framework it is important to mention other factors that have an impact on the performance of health personnel as favorable conditions. I'm sorry for apologizing. Could you go slower, says the President. Argentina, please, could you go slower? Even though for you this is a normal speed, but for the rest of us it is not. I apologize, Mr. President. As I was saying, within this framework, it is important to mention other factors that have an impact on performance of health personnel, as adequate labor conditions, permanent ongoing education, and in-network work. It would be useful to use different methods for planning and for estimating the human resource in health, such as a methodology of burden of work and the planning based on skills in order to develop policies that go beyond the policies and plans concentrated on the profession. We also have to promote that standards for graduate and postgraduate levels will give humanistic, professional, scientific, and technical education at the highest level in order to contribute to the preservation of the health status, the autonomy, and the well-being of people and the communities. The development of networks of professionals through information technologies, ICTs, could also be an opportunity in order to democratize the knowledge and to bring information to remote areas. Last but not least, we believe that it is relevant to support the draft resolution that is adopted on the conditions of the health personnel and the workforce for 2030.
Gracias.
Thank you, Argentina. We now give the floor to the U.S. delegate. Please, sir.
Thank you very much, Mr. Chairman, and good morning, all colleagues. The United States welcomes the policy on the Health Workforce 2030 and supports the accompanying resolution. As Director Barbosa noted this morning in his opening statement and vision, COVID-19 pandemic has had a devastating impact to frontline health workers in our region and around the world and exacerbated health inequities. We therefore commend the policies focus on building resilient health systems and support the 5 proposed lines of action. We encourage member states to continue implementing PAHO's strategic and technical guidance to develop better and more impactful strategies to strengthen human resources for health. For us, we prioritize strengthening and expanding our health and care workforce and expanding the equitable delivery of health care and public health services to remote, vulnerable, and marginalized populations, as well as ensuring that our health and care workers have what they need to thrive. We applaud the PAHO Global Virtual Campus for its work to provide training to health and care workers across the hemisphere, and we encourage partners to think about innovative ways to improve training, access to resources, and other assistance. I thank you.
Bien, gracias.
Thank you. And now Chile has a floor. Thank you very much, Mr. President. Chile expresses its gratitude and supports a PAHO initiative within the framework of human resources. To say that we participate in the multi-country study that was conducted by the organization in connection with the 2021-2022 biennium brought in my country a dialogue, a policy dialogue on human resources and the response to the COVID-19 pandemic, out of which we have, as a result, 5 strategic lines of action that we ought to work on in the future. In this regard, Chile will begin during this second part of the year the national update on policies on human resources by bringing in the general guidelines of PAHO proposal for 2030. This action line constitutes a challenge for managing human resources due to the fact that in my country, education is deregulated. It is up to each training center to develop the curricula that they deem appropriate or necessary. Therefore, this proposal by PAHO calls on us in order to begin work that is integrated with the Ministry of Education and the different training centers. Last but not least, to point out that the inclusion in primary health care, which is the central objective of my government in this management, as I was saying, to bring into primary health care a planning system for human resources is quite a challenge in the medium term and long term that calls for the use of a risk-based methodology in the network based on resilient health systems. Last, to let you know that these actions are prioritized in the plan, having a specific line on mental health for government officials and personnel that includes gender approaches in managing these resources. We have a huge challenge ahead of us in recruitment and retaining personnel in the health sector, bearing in mind the current conditions and challenges that are brought by the health situation in the country. Thank you. Thank you, Chile. And now we give the floor to Uruguay. Thank you very much, Mr. President. We would like to thank the Secretariat for the document presented. The COVID-19 pandemic has shown the challenges to which we have to respond, and one of them is to deal comprehensively with the strengthening of a workforce for health in order to achieve more resilient health systems. Having strategic guides for its strengthening is more than timely, particularly on issues such as the mental health of our personnel, the well-being of our health workers, training, and the different approaches by emphasizing women. We believe that this is more than beneficial. We also believe that it is high time, and we're happy to see that we're dealing with different forms of training of our staff and to explore communication paths in order to translate this into training online as well as in person, and to exchange best practices amongst our countries.
Finally, with regard to stigmatization, we believe it would be important to start thinking about a specific communication strategy to better communicate that strategy to us all. Thank you. Thank you. Let us move forward with the delegation of El Salvador. Thank you. Chair, we wanted, as others have done, to express our deepest appreciation to PAHO for what has been done on this subject. We've been working very closely with our national office precisely on the professionalization of people who are promoting this health workforce. They're our first line of defense, we believe. And up to now, it had only really been empirical or technical issues that had been conveyed, but we are determined to professionalize that workforce. Now, in that regard, we do have EMT focus on what is being done. We're going to be working a lot on telemedicine with greater digital capacity and palliatives. We're going to have people trained on palliatives at the first level of attention and in the hospitals, of course. Likewise, we're working on better training humans to deal with elder persons and more adult persons in the broader sense of the term. And this, by the way, is falling directly under the office of the First Lady, Gabriela Bukele. We do, in any event, wish to underscore the fact that we're going to stay with it and keep improving our human resources. Thanks very much. Thank you. I'm pleased to give the floor to Canada.
We applaud PAHO's efforts in providing strategic direction on how to strengthen human resources for health and achieving resilient health systems in the region. We strongly support the strategic line of action focused on the promotion of decent working conditions and protection of the physical and mental health of health workers. It is essential that we protect health and care workers from risks to their physical and mental health and well-being, safeguard their rights, and provide safe and secure work environments that are free of violence and harassment, racism, and discrimination. We also want to acknowledge other important aspects highlighted in this document, including integrated team-based care, workforce capacity building, and data availability, which align with our current domestic efforts. Canada has recently launched a Centre of Excellence on Health Workforce Data, which will lead a collaborative pan-Canadian approach to improving data collection, analysis, and knowledge mobilization. As such, Canada supports this document and its corresponding resolution. Moving forward on this initiative, we also encourage PAHO to continue strengthening its integration of health equity and gender equality considerations into its technical support provided to member states. Merci.
Gracias, Canadá. No hay nadie.
Thank you very much, Canada. There appear, El Salvador has spoken. Please put your nameplate down. Thanks very much. I don't think there's anybody else wishing to speak, as far as I can see. So that brings us to the end of our list of speakers. I am going to give the floor to Dr. Fletcher for his statement.
Delegations for their comments on this important policy document. What we've seen coming out of the pandemic is really a movement by countries to really strengthen health systems to ensure greater resiliency and capacity, not just to be able to respond to future public health emergencies, but also to comprehensively expand in terms to ensure access to comprehensive needs within the context of the 21st century in the Americas. This includes obviously addressing the issues of inequities, the persistent issues of inequities in access to health that have been exacerbated during the pandemic. And so critical to that is the process by which we plan and develop policy for the health workforce. This doesn't occur in isolation. It has to happen within the context of an overall definition of where the health system is moving towards and what the overarching objectives of that health systems are. Within that context of planning and policy development, we see an important challenge being faced by all countries at the moment. That's the effective recruitment and retention of health workers. And so some of the recommendations and comments coming from countries such as Argentina in terms of the planning processes are really critical, not just looking at planning in terms of the professional needs, but the interprofessional, as mentioned by Canada, the health team care-based approach, the interprofessional team approach at the primary care level. We're looking at the requirements also through the integrated health service delivery network is really, really important. And so we thank you for that comment. And this very much links in with a comment also from El Salvador, because as we see the population in the Americas is aging, we're going to have an enormous burden of NCDs that will really impact the capacity of systems to be able to respond. And so we're not just looking at healthcare professionals, but also social care and the social care needs that will be required by our countries to be able to address this. The planning processes are critical, and we already know there's a shortage of approximately 600,000 health workers if we're to achieve the 2030 goals. We're not so far off on doctors and physicians, but the biggest gap is in nursing, whereby we will really have to scale up the capacity and generation of nurses throughout the region of the Americas to be able to address the full needs of health systems as they continue to develop. So the issues around policy regulation, also Chile mentioned, this is an enormous challenge as we train and educate the workforce. I think we have not potentially paid sufficient attention to the quality of education, the accreditation processes within universities, the linkages between labour and education, and the commonalities that are required, the common standards that are required in the generation of the health workforce that we need. And there needs to be, I think, greater dialogue, and this is something that we're going to be working on in future, greater dialogue between countries around convergence potentially of standards in education so that we can elevate the quality of care throughout the health system, not just at the primary care level, but also in the provision of specialized care services. One particular issue that I do think we need to be very aware of, as was mentioned by Canada, Uruguay, and Argentina, is the issue of gender. We are aware that 70% of the workforce globally are women, are comprised of women. In the Americas, 56% of the workforce are nurses, and 90% of those nurses are women. And so what we observed during the pandemic exacerbates the impact in terms of women and their capacity to be able to not just provide as principal caregivers at home, but also their capacity to work within the context of health services. This is a major issue that I think we need to refine and adapt our policies that are more gender focused on women within the workplace, but obviously also women in terms of ensuring access to comprehensive care. Capacity building, I think, was mentioned by a number of countries. Brazil specifically requested information on the America's Health Corps. The America's Health Corps was an initiative that was launched jointly by President Biden of the United States as a collaborative initiative with the Pan American Health Organization last year to train 500,000 health workers throughout the Americas and to really strengthen and underpin the mechanisms that are in place in countries to effectively plan. What we've done really this year is to look with the United States around the mechanisms in place to strengthen those planning processes, to define the strategic actions that are required, and we've identified really two. First of all, the capacity building mechanisms, and secondly, the planning processes that I've mentioned. And we've been in discussion with the United States about then how we realign the financing that is currently available through the organization and continues to be made available, for example, through the grant, the $75 million that was made available last year for COVID-19, but also the additional funding that is available through USAID. We've noted that of the 500,000, we've reached about 40,000 specifically through the America's Health Corps. But I do want to note that through the PAHO Virtual Campus, we trained over 872,000 health workers directly in the region of the Americas last year. If we look at the top 10 courses, 6 of those 10 courses were in NCD care and management, which is really important as we continue to expand. This is one of the priorities of the director, to expand primary health care and the integration of NCDs in primary health care. We nearly trained almost 900,000 healthcare workers in this area. This is through the collective actions of voluntary contributions from many countries, including the United States, and the resources that have been mobilized. The PAHO Virtual Campus is really a mechanism that has scaled enormously during the pandemic. We now have over 2.3 million health workers registered within the campus. We have ready access to them through modern technology. And of course, we are now geo-referencing locations and looking to see where the health workers are so that we can directly access them with information. And so I think this is a very important and scalable action that we can do to leverage state-of-the-art knowledge directly into the healthcare environment. The budget that was developed for this proposal builds on the existing budget and scales it in terms of the priorities that we have identified, not just through the America's Health Corps, but also through other priorities that have been defined within the work program. We have been quite successful to date in the identification of additional resources. The director has assigned additional resources, as has DG TEDROS, as Catholic funding for health workforce issues. And we have proposals also that are being submitted to the Pandemic Fund also to scale action. Because I think if we do not do this now, we will find ourselves maybe 5 years, 10 years down the road in a similar situation where the systemic deficiencies in health work policy have not been addressed, and we really need to address those as a matter of priority now moving forward. So thank you very much, Mr. President.
Bien, señor director, ¿algún comentario sobre este?
Thank you very much, Mr. Director. Have you any comments? Thank you very much. Yes, well, very briefly, because I think Dr. Fitzgerald has already very satisfactorily responded to all of the issues that the member states had raised. I'd like to begin, of course, by expressing my thanks for everyone's contribution to this proposed policy. There was, as a matter of fact, intense participation when we made the rounds, and I think this will certainly be put before us by the next executive committee. But everyone says this is a priority, no surprise, for all of the reasons that have been pointed out. Because of the demographic transition, because all of the elements that the pandemic has made absolutely clear and cogent were missing, and the number of health professionals and their qualification, their training in very diverse areas, whether it's for primary care or more specialized care. We have to bend over backwards to make sure that we have a better grip on how we are working with our respective educational sectors and others, because clearly the issues that are before us today aren't going to be gone tomorrow. They're going to have a strong impact on tomorrow. Who knows what's waiting 6 months or a year down the line? So it's important for us to be ready with such a draft resolution as this to offer guidance, guardrails for technical assistance. And by the way, it would be wonderful if we could support every country in each one's planning in the various different channels of education. The name of the game is for the countries to be able to respond to the situation. Thanks very much, Chair. Thank you, Director. I now would like to ask the rapporteur to be kind enough to present the draft resolution. Thank you, sir. This is the Policy on the Health Workforce 2030, Strengthening Human Resource for Health to Achieve Resilience in the Health Systems. The 60th Directing Council, PP1, having considered the Policy on the Health Workforce 2030, Strengthening Human Resources for Health to Achieve Resilient Health Systems, document CD 60 CE 17214, resolves to recommend that the 60th Directing Council adopt a resolution along the following lines. Policy on the Health Workforce 2030, Strengthening Human Resources for Health to Achieve Resilient Health Systems. The 60th Directing Council, PP1, having considered the Policy on the Health Workforce 2030, Strengthening Human Resources for Health to Achieve Resilient Health Systems, document CD 60/X. PP2, Considering that the COVID-19 pandemic has demonstrated the importance of having health personnel who are prepared to respond effectively to health emergency events and to build resilient health systems, PP3. Considering that in order to achieve resilient health systems, recover health gains, public health gains, and contribute to social and economic recovery, it is necessary to strengthen the health workforce by taking actions to better protect the health of individuals, their families, and their communities. PP4. Recognizing that in order to ensure the functioning of health systems in the region of the Americas, it is necessary to continue to make changes in strategic planning and regulation of the activities of health personnel, as demonstrated during the COVID-19 pandemic, as well as to implement support measures, improve capacities, and broaden fields of professional practice. PP5, recognizing that despite the progress achieved, challenges remain, especially with regard to the availability and distribution of health personnel, planning, governance, intercultural, gender, and income equity among personnel, coordination between sectors, and training in accordance with the needs of health systems in relation to universal access to health and universal health coverage. Resolves, OP1, to approve the policy on the Health Workforce 2030, strengthening human resources for health to achieve resilient health systems, document CD60X. OP2, to urge member states, considering their context, needs, vulnerabilities, and priorities, to A, strengthen the governance of and promote national policies and plans for human resources for health in line with processes of health systems transformation towards universal health and resilience. B, develop and consolidate regulatory mechanisms for the organization of their human resources for health, education, and licensing processes, and professional practice to improve quality and equity to promote regional integration. C, strengthen the formation of interprofessional teams in integrated health services networks based on primary health care, especially in underserved areas. D, enhance workforce capacity building to address population health priorities and support public health emergency preparedness and response. E, promote decent working conditions, protect the physical and mental health of health workers, facilitate their participation in determining the organization of work processes, and improve financing and regulation to attract, retain, and sustain an adequate supply of human resources for health. F, improve the working conditions of health personnel in order to mitigate the effects of migration and promote the development of information systems and the reporting of labor mobility at the international level in accordance with the WHO Global Code of Practice on the International Recruitment of Health Personnel. OP3, to request the Director to A, provide technical cooperation to member states to strengthen capacities that will contribute to the implementation of the policy and its strategic lines of action. B, support the development of national policies, regulatory frameworks, and national capacities that will contribute to the strengthening of human resources for health. C, continue to prioritize the development of the Virtual Campus for Public Health as PAHO's educational platform, building capacities among health personnel and supporting the achievement of public health goals in the Americas in collaboration with academic institutions in the region. And D, report periodically to the governing bodies of PAHO on the progress made and the challenges encountered in the implementation of this policy through a progress report in 2027 and a final report in 2031. That's it, Chair. Thank you very much. Thank you. I give the floor to the plenary for any comments. There appear to be none. Are there any objections? None as well? Yes? Anybody want to speak? The United States has the floor.
Appreciate your efficiency in chairing the meeting. I just wanted to share a few comments. Definitely not an objection. I appreciate the presentation on the. Oh, I'm sorry. On the resolution. I'm sorry. I thought we would move to 4.4. Apologies.
Bien, gracias.
Right. Thank you. So, this being the case, this resolution is hereby declared approved. Thank you. Let us move to the next issue. That's 4.4. Policy on non-transmissible diseases. Policy on non-prevention and control of non-communicable diseases in children, adolescents, and young adults. I'd like to ask Dr. Anselm Hennig, who directs the non-communicable diseases and is with us at PAHO, to please join us at the head table in order to introduce the item at hand.
Distinguished delegates of the 172nd session of the Executive Committee, Dr. Jarvis Barbosa, Director of the Pan American Health Organization. The policy on the prevention and control of non-communicable diseases in children, adolescents, and young adults is being presented to you today to review the situation and approaches to tackle this public health issue and consider adoption of this resolution that will strengthen the response to NCDs in this population group. While children, adolescents, and young adults up to 24 years of age experience non-communicable diseases, especially obesity, type 1 diabetes, asthma, and certain cancers, efforts to address NCDs to date have focused mainly on the adult population. However, many NCD risk factors are adopted during childhood and adolescence, and this is a critical period to promote health and prevent the lifestyles which lead to obesity and other NCDs later in life. Promotion of healthy school environments can foster healthy lifestyle habits, including adequate nutrition and physical activity. Equally critical are efforts to increase access to primary health care. Therefore, this policy sets forth strategies and approaches for NCD prevention and control for children, adolescents, and young adults in the region. With a focus on equity, the policy seeks to strengthen NCD prevention through child health programs, strengthen primary health care and NCDs for this population, and improve NCD information in this population group. The policy draws on a set of cost-effective and evidence-based NCD interventions, the WHO Best Buys, approved during this year's World Health Assembly. The policy calls for 4 strategic areas of action. 1, integrate NCD prevention and control strategies into health programs for children, adolescents, and young adults. Secondly, develop multi-sectoral policies to improve health promotion, NCD prevention, and NCD risk factor reduction among children, adolescents, and young adults. Thirdly, strengthen primary health care services that incorporate digital health solutions for NCD diagnosis and treatment among children, adolescents, and young adults. And fourthly, strengthen capacity for NCD and risk factor surveillance to provide more timely and complete information on the status of NCDs, risk factors, and their determinants among children, adolescents, and young adults. We acknowledge the key contributions received from member states through the consultative process on this policy document held earlier this year, and would like to acknowledge our appreciation for these invaluable inputs and guidance. Thank you for your consideration of this proposed policy and resolution.
Gracias, Dr. Henny.
Thank you very much, Dr. Hennis. I offer the floor to the plenary.
¿Alguna intervención?
The United States has the floor.
Thanks, Chair. As you know, I'm very enthusiastic about this agenda item. No, appreciate Dr. Henny very much, the report, and for sure the United States welcomes this policy on prevention and control of NCDs in children's, adolescents, and young adults. We're also pleased to support the accompanying resolution and note the key connection with the PAHO strategy for improving mental health and suicide prevention in the region of the Americas. The United States recognizes the need to strengthen health systems, especially primary health care, and health promotion efforts to better meet the prevention, diagnosis, and care needs of children, adolescents, and young adults with NCDs, including mental health conditions. We also recognize the need to strengthen access to primary health care in response to health challenges for children, including for nutrition-related disorders and type 1 diabetes, and address broader social determinants of health that increase vulnerability, including access to adequate nutrition, physical activity, environmental risks, violence, and lead poisoning. The United States supports the multi-sectoral approach established in the strategic lines of action, and recalls that the WHO's best buys should be evidence-based, applicable across contexts, and developed through processes that include multi-stakeholder engagement. Finally, we appreciate PAHO's work on this important policy document and look forward to working together to prevent and address non-communicable diseases in children, adolescents, and young adults. I thank you.
The interpreter. We did not hear the name, excuse me. Thank you, Chair, says the Brazilian delegate. I wish to speak on this important issue of our policy on prevention and control of NCDs in children, adolescents, and young adults. As we see in Annex 1, this represents one of the toughest challenges that we have in public health. And therefore, it's important to be sure on what strategies make the best sense and will indeed make a difference with regard to our children and adolescents. To that end, we certainly feel that it's important to begin at schools and communities, not stay in the homes, to have a healthy environment, and to look at what actions can make a difference, particularly with regard to drinking alcoholic beverages, because we know the amount of sugar that's in there and other trouble that is certainly created, not to mention the potential for violence. So it's important to encourage countries to recognize that it matters to promote the best possible food and drinking in every way, in our publicity and our consumption. We in Brazil feel that healthy diets is key, and it's important that our dialogue at all levels be open and be transparent, and I thank you for putting this before us. Thank you. Thank you, Brazil. The delegation of Suriname has the floor.
Thank you, Mr. President. Suriname would like to thank the Secretariat for the joint effort for this policy. NCDs continue to be the leading cause of ill health, disability, and death in the region of the Americas, including Suriname. Yet much of the burden of NCDs in adulthood is related to modifiable risk factors early in life, as children and adolescents are exposed to social and environmental determinants of health. Some of the actions in tackling the NCDs problem by the Ministry of Health Suriname include the establishment of a ministerial NCD task force for coordinating policies on NCDs and mental health, formation of a Suriname NCD Alliance 23-28 with private sector, civil society, NGOs, and others, Policies to address the social and commercial determinants of health, such as increasing and allocating taxes on cigarettes, alcohol, and sweetened beverages, continue front of package labeling with health hazard warning, community education on health choices, comprehensive monitoring and policy adjustments on NCDs and mental health. Suriname requests the PAHO for setting of databases such as nutritional value or facts databases in order to decrease duplication in research or investigation. For example, plantain is used in many countries. If one country does research in the nutritional facts of plantain and sets up a database, other countries can use this information in the formation of their food policies. As we know, Jamaica has done a nutritional facts study on 300 imported preserved foods. Out of those 300 products, a specific percentage stated that those products did not contain trans fat, which actually contained trans fat. If this information also becomes available in a database, other countries can use this also instead of reinventing the wheel. Mr. President, Suriname thanks the PAHO for its continuously support in tackling the NCDs. Thank you, Mr. President.
Gracias.
Thank you, Suriname. The next speaker is Argentina. Thank you, President. Argentina has taken note of the policy on prevention and control of non-communicable diseases in children, adolescents, and young adults. We'd like to especially note the need to consider the entire set of social and community factors that have an impact on the health and development of our children, adolescents, and young adults, as well as income inequality, health spending, access to education and to health services, as well as job opportunities, among others. As to the comprehensive strategy to prevent cervical cancer, our country has introduced HPV vaccination, and it's included in the national vaccination schedule, and has also introduced primary screening methods. As to the cost-effective interventions for NCDs, we'd like to note a few at the national level, such as the promotion of healthy diets, which includes clear packaging of foods and beverages, the bill on zero alcohol if driving, also the tobacco control bill, and also the framework agreement of WHO on tobacco use for subsequent ratification. Furthermore, on cancer in children, Argentina has approved an oncopediatric law in 2022 with the aim of covering all children, adolescents, and young adults with cancer, providing them coverage beyond their health insurance with a focus on patients and the families. This law affords them access to monthly assistance, also leave for parents or other responsible parties, access to cancer medication, and free use of public transportation, among other measures. Our delegation would like to lend its support to the proposed resolution on the policy and its strategic guidelines, and we especially welcome the reference to mental health of this population group. Thank you. Thank you, Argentina. Next is Chile. Thank you, President. Chile welcomes this document and has two suggestions we'd like to have included. First, beyond epidemiological surveillance, our country considers that having national health surveys, which include behavioral aspects, is key when formulating new policies. And speaking of new policies and effective policies, we suggest that the title and the content of this document include the concept of health promotion. The organization has included a reference to prevention and control, but to do this, it is important to engage in health promotion and in promoting healthy habits and behaviors. So that is our request. Thank you very much. Thank you, Chile. Next is the delegate of Cuba. Thank you very much, President. Cuba believes that it behooves us to focus on preventing NCDs in children, adolescents, and young adults. This is one of the best things we can do to prevent and limit the impact of NCDs and improve a healthy life expectancy in the medium and long term. Therefore, we must specifically consider theories on the origin of disease and health when considering an approach to NCDs. We believe it's also important to encourage participation of developing countries in research efforts in this connection. In the case of Cuba, since 2020, we have worked with the Institute on Hygiene and Microbiology to promote health during the first 120 days of life. We believe that this should be essential for prenatal care. We need to prioritize comprehensive health in schools and also reintroduce preventive measures in schools, training specialists in this discipline. We should also promote fuller integration of mental health and care for mental health issues as we establish an approach to NCDs. Thank you. Thank you, Cuba. We now move on to El Salvador. Thank you very much, Mr. President. El Salvador acknowledges the importance of the policy on prevention and control of non-communicable diseases in children, adolescents, and young adults, and supports the resolution. As a country, we've worked on early detection of risk factors with the focus on health in schools as part of a strategy we carry out with the Ministry of Education. We also offer friendly and differentiated healthcare services for adolescents, covering all aspects of health, including exercise as a way to promote health, also reduction on the use of electronic devices because they lead to a sedentary lifestyle, and also improving food, nutrition, and drinking, as well as limiting tobacco use. We welcome any support PAHO can provide us to extend this strategy to all health units in our country. Thank you. Thank you. Next, we have the delegate for Mexico. Thank you, President, and we congratulate you for the work you've done at the helm of this meeting. Mexico welcomes this public policy proposal and would like to stress everything having to do with prevention. We believe that prevention should be a top priority because of its strategic importance. Countries should attach high priority in our public policies to this area, and Mexico considers that it's a highly vulnerable sector, as was shown during COVID-19. This group is highly sensitive to many issues that may not be at the center of our public health debate. Mexico has made great strides in the area of prevention, and I'd like to note 3 of these. First is packaging of foods, and this has to do with one of the major challenges we face with this group, especially in Mexico, especially in connection with obesity. Mexico is dealing with this public health problem by using front labeling. Also, I'd like to mention everything we've done in the area of smoking. and combating smoking. Again, we have added front labels and have promoted public policies in this area, and yet have faced a challenge because there are sectors that draw their revenues from these two activities. Also, during COVID-19, we have provided specialized care to girls, boys, and adolescents, given that they were hard hit by the anxiety brought on by this health crisis. Mexico considers that it is pressing that public policies in this area include a significant and strategic preventive component. Thank you. I thank the delegate of Mexico and call on the delegate of Canada.
Thank you. Canada welcomes this proposed policy and is grateful for having had the opportunity to provide comments as the policy was being developed. It highlights important actions to be taken at critical points early in life and is particularly relevant given the NCD-related trends identified in the Americas. We also appreciate that the policy draws from existing efforts, including the updated set of cost-effective NCD interventions, which were endorsed at WHO governing body meetings earlier this year. Canada acknowledges the importance of surveillance information with emphasis on determinants of health and inequalities, which are critical to identify trends, socioeconomic contexts, and priority populations to help advance equity-focused actions. In this regard, we stress the importance of the collection of disaggregated data. There will be and would be significant benefits in promoting the development and dissemination of concrete actions and resources which member states could employ to proficiently execute this policy. We do have a question about PAHO's approach to collecting supplementary data to effectively address some of the identified gaps that were mentioned in the policy document, and wonder if PAHO could provide any further information or details on plans in this regard. Merci.
Yes, gracias.
Thank you, Canada. Are there any other speakers wishing to take the floor? If not, I will ask Dr. Hennis to address some of the comments we have heard.
Mr. President, thank you much to the member countries who have made comments to the strategy. And basically, I think it really shows the prioritization of this topic throughout the member states. And as one member state said, this is one of the toughest public health challenges that we all face. And we all recognize that really for the first time in mankind's history, unless interventions succeed, we are looking at our children and generations to follow being sicker than we are and living shorter, less healthy lives than we live. So really the urgency and the importance cannot be underestimated. As noted, issues such as social determinants, issues of equity, issues of risk factors, the stage in life when these can be adopted, the role of the commercial determinants, and we heard also of issues of, for example, front of package labeling. We learned a lot about in terms of environments in which children live. We learned about diets. We learned about issues like front of package labeling. We learned about tobacco. So all of these issues begin early in life, and the children then go on a trajectory towards ill health and NCDs in later life. So I think we all recognize the importance and the prioritization of what needs to be achieved. There are issues in terms of mental health. And in fact, while mental health is a key component of what is being discussed here, there's actually a separate policy and strategy on mental health, which is linked to this resolution. So, so the mental health issues are not directly included here, but they will be presented in a subsequent resolution. So that is a linkage with mental health, which we recognize as being really very critical. The issues in terms of the health promotion, and yes, Chile through the issuement of health promotion, this is actually a key element as well of what we hope to achieve, because health promotion will be a key component, particularly in terms of altering behavior, particularly in terms of acculturation, particularly in terms of school environments. So this is very much part of what came up in the consultations of member states and is a key pillar of what we hope to achieve as well. The issue raised by Canada about data, and as you know, we do conduct surveys, particularly Latin America and the Caribbean countries, and we use STEP surveys as one of our key pillars for data collection. We also have the global youth tobacco surveys. We have the global school health surveys. So there are a number of areas in which, a number of mechanisms through which we collect data. It is true, however, that some of these surveys have been delayed because of the pandemic. So we hope that within a reasonable period of time in the near future, we can actually address some of these information gaps and data gaps that we currently face, which have been upended because of the pandemic. And in fact, I will also acknowledge the support we have had from Canada in terms of surveys that we've done in the Caribbean region, which has really been very helpful in terms of addressing information gaps. So I think those are some of the key issues that I wish to share, and I'm really to thank the member states for recognizing the urgency, and we look forward to working collaboratively with the member states in terms of advancing this policy and the fruits that it will potentially yield to the well-being of our young people, adolescents, children. And I think the added advantage of this policy as well is that when one tries to create better environments for children and young people and adolescents, it also redounds positively to the environment for adults as well. Thank you, Mr. President.
Gracias.
Thank you, Dr. Hennis. I now offer the floor to the director, should he have any comments to make. Thank you very much. I believe Dr. Hennis has answered all comments very thoroughly. I do wish to thank all member states, not just for their important comments about this major proposed policy matter, but for also sharing information about the initiatives their countries have adopted in order to respond to the challenge posed by chronic non-communicable diseases in children, adolescents, and young adults in their countries. I think it is important. I also appreciate the fact that a number of countries mentioned first that it's important to include health promotion as part of our efforts, as referenced by Chile. It should be in the resolution because it is one of the public policies that can have an impact on risk factors and can also address social, economic, and commercial determinants which lead to a rise in obesity and weight gain and make this population at risk, and also increases the load of NCDs in this population group, and also the importance of having a multi-sector approach. The health sector, when implementing these policies, has to partner with the ministries of education, the economy, among others, also civil society, and many other important partners. I would say that when it comes to monitoring policies and also providing more support to countries to collect more data, disaggregated data that can help us track these challenges is essential. So it means to have a different type of vigilance, a different type of surveillance that from the one we have for SCDs. As Dr. Hennis explained, it's important to have more countries systematically look at these things so that we can collect disaggregated data that can serve as a source of information so that we can track not just progress, but also information gaps we have so that we can do better in this area. As Dr. Hennis said, this is a challenge for all of us as we seek to promote this generation and the next generation so that we not only extend life expectancy as compared to our generation and that of previous generations, but also provide for a healthier lifestyles for the boys and girls, our children, and our young adults today. Thank you. Thank you, Director. We would now ask the rapporteur to introduce the proposed resolution. Thank you. Proposed resolution, policies on prevention and control of non-communicable diseases in children, adolescents, and young adults. The 60th, the 172nd session of the Executive Committee, PP. Having reviewed the proposed policy on prevention and control of non-communicable diseases in children, adolescents, and young adults, document CE 172/15, resolves OP to recommend that the 60th Directing Council adopt a resolution along the following lines. Policy on prevention and control of non-communicable diseases in children, adolescents, and young adults. The 60th Directing Council, PP1, having reviewed the policy on prevention and control of non-communicable diseases in children, adolescents, and young adults, document CD60/X, PP2, recognizing that non-communicable diseases, NCDs, continue to be the leading causes of ill health, disability, and death in the region of the Americas, but that efforts to address NCDs to date have focused on the adult population, with children, adolescents, and young adults, 24 years of age and younger, largely overlooked. PP3, understanding that common NCDs such as type 1 diabetes, asthma, and certain types of cancer can appear early in life, and that, furthermore, much of the burden of NCDs in adulthood is related to modifiable risk factors that have their origins in the prenatal period and childhood and continue to accumulate as older children and adolescents are exposed to additional social, environmental, and commercial determinants of health. PP4. Considering that cost-effective and affordable population-level interventions to prevent and control NCDs exist, including those that address the social, environmental, and commercial determinants, as well as modifiable NCD risk factors during critical time periods for intervention, and that these can be delivered through community-based, school-based, peer-based, and family-based platforms. PP5, recognizing the need to strengthen health systems with a focus on primary health care to better meet the diagnosis and care needs of children, adolescents, and young adults with NCDs. PP6, acknowledging the need to improve surveillance to provide more timely and complete information on the status of NCDs, risk factors, and their determinants among children, adolescents, and young adults for the purpose of policy formation. Resolves OP1 to approve the policy on prevention and control of non-communicable diseases in children, adolescents, and young adults, document CD60/X. OP2, to urge all member states, considering their contexts, needs, vulnerabilities, and priorities to A, promote the implementation of the strategic lines of action contained in this policy, B, enhance child, adolescent, and young adult health programs through the integration of NCD prevention and control strategies in school-based and community health programs targeting this population group. C, improve health promotion, NCD prevention, and NCD risk factor reduction among children, adolescents, and young adults through multi-sectoral actions that target reduction in tobacco use and harmful use of alcohol and promote healthy diet and physical activity. D, strengthen primary health care services to increase coverage, access, availability, and quality of services for NCD screening, diagnosis, treatment, and palliative care among children, adolescents, and young adults. And E, strengthen capacity for NCD and risk factor surveillance to provide more timely and complete information on the status of NCDs, risk factors, and determinants among children, adolescents, and young adults with an equity lens. OP3, to request the director to A, promote technical cooperation to member states to strengthen capacities that contribute to the implementation of this policy and the achievement of its strategic lines of action with support for the implementation of NCD best buys, integrating NCDs into primary care, resource mobilization, and partnerships. B, support member states to strengthen multi-sectoral actions on NCDs based on a health in all policies approach with policy coherence across relevant government sectors and promotion of civil society participation in prevention and control of NCDs among children, adolescents, and young adults. And C, report periodically to the governing bodies on the progress made and challenges faced in the implementation of this policy through a midterm review in 2027 and a final report in 2031. That is all. Thank you. Thank you. I thank the rapporteur and give the floor to the plenary for discussion should anyone wish to speak. No one? That being the case, if I hear no objections. Sorry, Chile? I'm sorry, I didn't see you. No, I had not really raised my hand yet. Thank you, President. I'm sorry, but I do want to strengthen the behavioral variable. I believe it should be specifically mentioned somewhere in the text. I think epidemiological surveillance is a core instrument. I won't say anything to the contrary, given what the director has said about its importance, but I do believe that the behavioral, social, and cultural aspects, which are covered in the text between the lines but are not mentioned specifically, should be made more explicit. Thank you.
Un momento, por favor.
Thank you.
Sí, adelante, por favor.
Thank you, Mr. President. Thank you very much for those remarks from the delegate from Chile. We have mentioned the health promotion in the resolution under item EC, but I think we are quite happy to receive written comments so we can incorporate the suggested changes.
Thank you. I will.
Bueno, Chile nos quitó el impulso de aprobar la declaración.
I think we lost our momentum given Chile's intervention. We will take a few minutes to review the text and work on a final version. We will come back to it later. So we will leave this aside for now and come back to it later. Would you agree to that?
Lo otro que me informan
I have also been told that it's almost time for our lunch break. But lunch is not ready yet. It's a bit early. So we will proceed with the next item on the agenda, which is 4.5, Strategic Communication in Public Health for Behavior Change. I would like to note document CE 172/16 and invite Dr. Sebastián García Saizo, who heads the Department of Evidence and Intelligence for Healthcare, to join us at the head table to introduce this item.
Gracias.
Muchas gracias, presidente.
Thank you very much, Mr. President, Director, and distinguished members of this Executive Committee. A very good afternoon to you all. I'm very pleased to present this document, which focuses on a focus in order to broaden the impact of our public health policies. The whole point of this particular document is to underscore the critical nature of strategic communications in public health for behavior change in the region of the Americas. This document also presents a number of lines of action, 6 in fact here, for implementing technical cooperation activities at the regional and country levels. Now, historically, PAHO and its member states have developed an array of initiatives and activities of various sorts, all aimed at improving the tenor and the impact of strategic communication on public health policies. And indeed, our mandate shows this, including the strategic plan of the 2025 period for PAHO. That said, given the abundance of different technologies and various other different elements that are before us, never mind the impact of the pandemic, which we're all facing, we all have recognized that it is important to develop something a little more holistic, something a little more substantive, in order that the heart of these policies may be better understood and that people have a better grasp of what they can do to make healthy choices. So the concept paper you have here shows how, in the development and implementation of public health policies aimed at supporting strategic communications in public health for behavior change, we can move forward. This talks about how the challenges member states are confronting can, in fact, be better focused in order to have social and behavioral science strategies be more within the grasp of the public, and also to ensure that the new technologies are also better understood and that data, massive data, and others that will make a difference to people being able to have a more cost-effective impact are all available. Lastly, all of this provides elements member states should consider. These are all, of course, reflected in the World Health Organization, and it establishes a specific framework to foster actions on knowledge management, information access, and health communications. We see, therefore, the need to move forward with renewed models, and I say again, more holistic approaches that will be interdisciplinary and intersectoral in their nature. Presently, digitally connected policies, and the public gives us an unprecedented opportunity to do all of this, have an impact on individuals and on societies. And that is why we wish to develop more effective public policies that will focus on health, particularly with regard to health itself, to the prevention of disease, and focusing on the actual needs of health in the indigenous populations and other special needs groups. I would point out that we are launching a process that is, as you can guess, extremely complex. And that is why this is considered a first draft, if you will, in our conceptual notes. We have priority aspects here, as for instance, the analysis of massive data, the contribution of the better understanding of pandemic, infodemic, and other technical and scientific inputs, better management of public information, including the public networks, and a better digital literacy, and a more comfortable level of wandering through all of this morass of data. We've talked about this at great length back in April of 2023, just a few months ago, and have taken in here a number of comments and inputs that we think will make a difference. And all of that said, we think that in order to improve the digital nature of this, we're proposing 6 lines of action in order to get a better sense of what we have and begin to offer a framework that will offer health components of behavioral science programs, among others. We would invite, then, you all here to examine this document and drill down into such elements as you consider more pertinent and hopefully approve the draft resolution that you have at the end of this document. Thank you. Thank you very much, Dr. Garcia Sarso. We're very pleased to hear this and offer the floor to the plenary for any comments you wish to make. Let me see who was first. I think it was our colleague from Argentina. Go right ahead. Thank you. Argentina, sir, is very grateful to the authors of this conceptual document. We think that the points made here are particularly important, not least in a context of public health emergencies. We know a good bit about this after the pandemic, and a couple of the examples we can give was the great deal of resistance to vaccination, fake news, and a number of other problems that filtered through our digital sources of information. It is clear that we need better tools and more innovative approaches in order to be sure we're tapping into the community's social and health habits so that people are prompted to actually come up with better and more manageable, more sustainable, healthy lifestyles. We hope that we can somehow offset, in so doing, the mistaken, sometimes unwillingly and sometimes very deliberately, mistaken news, erroneous news that gets to people. We think that at least we should use this pandemic and our lessons from it to generate more trust. One would be, and these strategies were already tried during the pandemic, to generate greater trust in the vaccines. So we are pleased to support this proposed resolution and its 6 lines of action. Thank you very much. Thank you, Argentina. Pleased to give the floor now to the delegate of Chile. Thank you, sir. Chile is very grateful for this proposed resolution, and we think it is very welcome. And quite frankly, tallies perfectly with my previous remarks this morning. So I would here again insist, if I may, on including the notion of promotion and protection of the information. And I think that is simply, conceptually speaking, and from a health standpoint, a no-brainer. Now, we have a good bit of experience with regard to HIV/AIDS, for instance, and have come up with the need for successful, massive information strategies. So we know something about this, and we know what works and what doesn't with civil society. We know also how we managed or failed to manage during the pandemic. So we're not coming at this cold, and I think that these tools that have been usefully proven to be so should be borne in mind here. And we support this resolution. Thank you. Thank you, Chile. The United States has the floor.
Thank you, Vice President. The United States thanks PAHO for developing the Strategic Communications and Public Health for Behavior Change concept paper, and we appreciate the consultative process to inform this document. We support the development and implementation of public health policies aimed at supporting strategic communications and public health for behavior change, and we welcome the concept paper's proposed 6 lines of action. We recognize the importance of effective communication strategies to promote behavior change, as underscored by the challenges that we've all noted and faced during the COVID-19 pandemic. We recommend that an updated concept note recognize the importance and the value of time-sensitive development and the need for systems and tools that allow nimble, near real-time processing, analysis, and reporting, especially for addressing the observed disparities across diverse communities. We would also like to see an additional emphasis on programs and actions that are focused on lowering barriers to taking action and making sure that viable options exist for following through on health choices and creating incentives for initiating and maintaining healthy behaviors. We also suggest that the dichotomy between what is termed accurate and fake information in the paper requires some more nuance and careful definition of terms in an updated concept paper. We appreciate that updates have been made to this draft and see a lot of feedback reflected there. We hope to provide a few additional comments in writing, and along with this, we have one substantive change for consideration on the resolution text, which we'll leave for when we get to that discussion. Thank you.
Gracias a la...
Thank you. Distinguished Delegate of the United States, Brazil has the floor. Thank you, Chair. We applaud this initiative. We think it is very necessary, and we certainly welcome it, and do agree with Annex A, which lists the number of elements that we think are useful to remember. In the context of COVID, we have focused on how we could move forward in a more effective and in a harder-hitting manner to offer the best way that populations could behave in terms of protecting their health. So we have some experience here. However, we're thinking also of innovation, of how we can improve social measures vis-a-vis society itself, and how in some instances tools or decisions can be personalized so that the steps taken are more healthier and longer lasting. The idea is to help the protection of the public and to remain active in the social context so that we understand better the needs of each context, particularly when we speak, as we often do, of particularly vulnerable groups or groups that have specific vulnerabilities, better said. Here, we need to be clear about how best we can offer views that are, from a democratic standpoint, most effective to protect those groups. We appreciate the fact that PAHO, through its technical assistance and the development of good policies and tools, has made such a difference and will continue to do so, so that people understand better the importance of their own individual and collective behavior. I'm just thinking, Chair, with regard to the strategy that is proposed here by the Secretariat, which is, as we know, based on commitments that the governments themselves presumably will be undertaking vis-a-vis their individual policies. I want to say, too, that, of course, this goes to PAHO and each individual member state. That's all fine and well, but here's what's missing, we believe. It'd be good to set up some dialogue, some forum that would, with academia, with civil society, in order to be more effective in exchanging views and getting a better grip on what the challenges are. What do those different actors know because they've experienced it? We believe it would be a useful element to garner and very useful throughout the region. because this is a difficult challenge. I don't think for that purpose we need to change the draft resolution, by the way, the proposed resolution, but I'm just mentioning it to the Secretariat here at PAHO so that it can let it brew a little bit in the next couple of months and maybe tell us more in the coming months or maybe next year. Thanks very much. Thank you very much, Brazil, says the chair. Pleased to give the floor to the delegate of Cuba. Thank you. Mr. Chairman, Cuba is very pleased to see these 6 strategic lines that are included in the document. We think they're all good, and amongst them, we could include, perhaps in a more explicit manner, something to do with local or community communication, so that we have a better grasp on how the participation of that local community might in fact work. That sort of thing would be very useful, I think, particularly in considering changes of behavior. In Cuba's case, we certainly would ask that in the consultation process you include another 2 centers that are very specialized here, the Collaborative Center on Networks that works with the University of Havana in the Department of Communication, and then also the Department on Scientific and Technology in the School of Medicine. Cuba feels that this is a very important document that will establish no less a framework that will serve us all as we move forward and try to identify the characteristics and the actual needs of every country, to each his own, and what we've learned through COVID. There have been pluses and there have been minuses in our communications. I think we can all agree to that. But we support this proposed resolution, and thank you for it. Thank you. Pleased to give the floor to the delegate of El Salvador next. Along those same lines, Mr. Chairman, we too have seen great strides since the pandemic and an understanding that we need to do better when it comes to communication. And whether it's the media, TV, official channels, it is no longer the same old formal governmental communication. It has become the real backbone of what everybody is talking about and doing in the country. Because, you know, you could be doing wonderful things. If nobody knows about it, what difference can it make? So we support this proposed resolution. And we think it is critical that we continue to foster that bilateral communication so that those strategic lines, as they relate to each one of us, jointly and severally, can make the better for it all, for us all. Thank you. Thank you, El Salvador. Pleased to give the floor to Canada.
Thank you, Mr. President. Canada strongly supports PAHO's efforts at enhancing communication strategies for behavior change in the region. This paper aligns with Canada's health priorities. As evidenced by our recent co-sponsorship of WHO's Behavioral Sciences for Better Health resolution, Canada is committed to leveraging behavioral sciences to improve health outcomes and enhance public policy effectiveness. In 2021, recognizing the wider value of behavioral science for effective public health interventions and strategic communications beyond the pandemic response, the Public Health Agency of Behavioral Science Office. Noting efforts both globally and regionally in this area, we urge coordination and collaboration between PAHO and WHO, including engaging WHO's Technical Advisory Group on Behavioral Insights and Sciences for Health to exchange best practices and lessons learned and ensure overall alignment in the advancement of similar priorities. Canada stresses the urgency of prioritizing public trust in health information and promoting transparency, credibility, and accountability in communication efforts. By fostering trust and delivering accurate, timely, and evidence-based and gender-integrated messaging, we can empower individuals and communities to make informed decisions and counter misinformation and disinformation. We support emphasis on the need for interdisciplinary approaches to apply behavioral sciences in public health, and we also underscore the significance of nurturing strategic communications to drive behavior change, provide context-specific information, and facilitate exchange of valuable lessons and best practices in public health communications. We appreciate the current iteration of this paper, and we take the opportunity to offer the following suggestions. We propose the use of terms such as encourage rather than influence to avoid negative associations with the notion of control through behavioral science. Emphasizing significance of messengers and building public trust is essential, which can be achieved by enhancing perceptions and understanding their roles and responsibilities. Finally, to ensure a holistic and comprehensive understanding of information dissemination, we suggest highlighting traditional media and community-driven channels as significant sources alongside digital solutions. Thank you.
Gracias. Gracias,
Thank you very much, Canada. Next up, the Ambassador from Mexico. Thank you. Chair, thank you very much. We want to thank PAHO for this agenda and congratulate those who put it together because we certainly know that communications, strategic communications in public health for behavior change saves lives. And so it's important that we work collectively because public health, as we well know, has proven to be one of the most vulnerable to fake news. And fake news costs lives. So we very much support these 6 strategic lines that we have in the proposed resolution 17216. Thank you. Thank you, distinguished Delegate of Mexico. Does anyone else wish to take the floor, I wonder? Appears not to be the case. There are a few signs up, but now not. I've been given a couple of different notes of information. I'm going to see if I can wade through them. We have decided to stop now at 4.5, time for lunch. And we will start with 4.5, what's left of it, after lunch. So we will interrupt here, and with a good lunch, we'll come back with renewed vigor. Then we'll move on to 4.6, then 7.1 and 7.2. And if there's time today, we shall see 7.3. And so, given this information with which I presume you all agree, I would like to give the floor to Dr. Marilu Valdez for some additional information. Please go ahead.
A change, colleagues. The commemorative photo of the executive committee participants will now be taken tomorrow at 12:30, as soon as the meeting breaks for lunch. This will allow time for all delegates of the executive committee to arrive. So, for tomorrow. Thank you, Mr. President.
Bueno, ratificamos.
Well, we certainly agree that that's where we leave it before lunch. And see you all 2 p.m. on the nose. Thank you very much. Meeting stands adjourned.
Yeah, it's perfect. I just have the streaming, but it's fine. Yeah.
¿Sabía que 1/3 de los presupuestos de salud se destina a la compra de medicamentos? Altos costos, calidad insuficiente y productos poco disponibles en el mercado, además, pueden representar una carga extra para los presupuestos de salud y amenazar la sostenibilidad del sistema. Por eso, y a pedido de los países de las Américas, la Organización Panamericana de la Salud creó el Fondo Estratégico en el año 2000. El fondo es un mecanismo solidario para la compra conjunta de medicamentos e insumos de salud pública de calidad. Consolida la demanda de múltiples países, convoca licitaciones internacionales y obtiene precios reducidos al adquirir grandes volúmenes del mismo producto. También apoya a los países para mejorar la planificación de la demanda y evitar desabastecimientos. ¿Qué productos se pueden adquirir? Más de 250, desde tratamientos para diversas enfermedades, transmisibles, no transmisibles y desatendidas, hasta equipos médicos, insumos y kits de diagnóstico. El Fondo Estratégico ofrece líneas de créditos a los países que lo necesiten a través de su cuenta de capitalización. El uso del fondo genera ahorros en los presupuestos de salud. En solo un año, un país ahorró $13 millones en la compra de medicamentos para VIH-Sida y tuberculosis. Todos los productos adquiridos a través del fondo son seguros, eficaces y de calidad garantizada. Para utilizar el fondo, los países, a través de sus ministerios de salud, deben firmar un convenio con la OPS. ¿Por qué hacerlo? Porque más y mejor acceso a medicamentos e insumos es clave para garantizar la salud para todas las personas en todas partes. Para conocer más, ingrese a www.pajo.org/Fondo Estratégico.
Hello, Paula.
Buenos días.
Bom dia.
Hola.
Oi.
Buenos días.
Oi.
É um prazer te conhecer. O que você gostaria de falar hoje?
Beber álcool pode causar câncer?
Há uma forte ligação entre o álcool e as doenças crônicas, particularmente o câncer.
How can I make sure I drink responsibly?
I'm sorry to say, but there's no such thing as responsible drinking.
¿Cómo sé si estoy bebiendo demasiado?
Puedo ayudarte a evaluar si lo que bebes puede causarte daños.
Hi, I'm Paula. I'm the Pan American Health Organization's first digital health specialist on alcohol use. I was built to provide reliable information about the impact alcohol can have on your health. I can also help you check if your drinking is putting your health at risk and guide you through a plan to cut back. Do you think you could benefit from drinking less?
I know I would. Can you please help me?
I'd love to help you. And I promise I won't judge. I'm a digital person after all. I don't know how to judge.
Did you know that 1/3 of health budgets are used to purchase medicines? High costs, insufficient quality, and hard-to-source products in the market are major barriers to access medicines and threaten the sustainability of the system. For this reason, and at the request of the countries of the Americas, the Pan American Health Organization in 2000 created the Strategic Fund. The fund is a mechanism for pooled procurement of quality medicines and public health supplies. It pools the demand of multiple countries, executes international tenders, and achieves reduced prices when purchasing large volumes of the same product. It also supports countries to improve demand planning and prevent stockouts of medicines and health supplies. What products can be purchased? More than 250, from treatments for various diseases, communicable diseases, non-communicable diseases, and neglected diseases, to medical devices, supplies, and diagnostic kits. The Strategic Fund provides lines of credit for countries when needed through its capital account. The use of the fund allows savings in health budgets. In just 1 year, one country saved $13 million in the procurement of medicines for HIV/AIDS and tuberculosis. All products procured through the Strategic Fund are safe, effective, and quality assured. To use the fund, countries through their ministries of health need to sign an agreement with PAHO. Why do this? Because improving access to medicines and supplies is key to guaranteeing health for all, everywhere. To learn more, visit www.paho.org/strategic fund.
I am.
We are.
All of us. Together.
This is who we are.
Our humanity. The hopes we share.
The struggles we face.
The stories that define us.
Individually, collectively, universally.
Every person.
Family.
Community.
We are happier when we have each other.
Healthier when we stand together.
Every one of us matters.
No one should be left behind.
We all have the same fundamental right
to health and happiness.
To the care we need.
Wherever we live.
Whatever we have or do not have.
Regardless of age,
race,
language,
culture, or circumstance.
This is our mission.
We stand together with all people.
In every community, every country, throughout the hemisphere.
Because we are healthier.
Together.
We are the Pan American Health Organization, working for health for everyone, everywhere.
¿Qué van a hacer aquí ahora?
¿Qué vamos a vacunarse?
¿Qué vacuna les van a poner?
La gripal y la varicela.
Estamos muy contentos, es la 20ª semana de la vacunación de las Américas. Hemos estado presentes en 44 países, hemos estado alcanzando 139 millones de personas y aquí en Argentina la semana de vacunación tiene muchísima relevancia porque se vive desde hace muchos años, desde que empezó en realidad, y se vive a todos los niveles, y es lo que hemos visto durante esta semana, es decir, a nivel de gran ciudad de Buenos Aires, como también provincias.
Una semana muy intensa de trabajo, de concientización, de fortalecimiento en la vacunación, articulando con Nación, obviamente, con la OPS, con la representante de la OPS, y la verdad que ha sido muy emotivo lo que hemos hecho acá en Cafayate y en Animaná.
la Semana de Vacunación de las Américas número 20 de la región de las Américas y 11 mundial por el liderazgo de la región de las Américas en vacunación. Es muy importante para Argentina, siempre es muy significativo, es una fiesta, es una semana de fiesta en todo el país donde todos los integrantes del sistema de salud y los vacunadores y las vacunadoras tienen un rol enorme, pero se habla de algo que nos da mucho orgullo en Argentina, que es nuestro calendario de vacunación y la confianza que tiene la población en las vacunas. Es muy emocionante y da mucho orgullo.
Hay que continuar durante cada semana, durante cada mes, para asegurarnos que llegamos a recuperar ese calendario y con el acompañamiento del OPS estamos seguros que poco a poco iremos avanzando y lo iremos consiguiendo.
E Biomanguinhos foi oficializado como um instituto produtor de imunobiológicos na década de 70. Desde então, Biomanguinhos vem junto com o Ministério da Saúde, Programa Nacional de Imunizações, a Organização Pan-Americana de Saúde, a OMS, como um dos fornecedores principais de vacinas na América Latina. E neste momento, nós estamos em fase de desenvolvimento da tecnologia da vacina em RNA, nessa nova plataforma. Então, estamos detalhando os equipamentos, os rendimentos, todos os resultados que são esperados, não é só em termos de produção, como em metodologias analíticas de controle de qualidade, com o intuito de, no próximo ano, já termos as primeiras etapas de escalonamento e produção, visando os estudos clínicos necessários para essa vacina.
Synergium Biotech es una empresa de biotecnología aquí en Argentina y nos dedicamos a la producción de vacunas principalmente y otros productos biotecnológicos. Synergium Biotech tiene ya hace 2 años una participación en el Fondo Rotatorio de la Organización Panamericana de la Salud con la vacuna antigripal justamente, y tener esta capacidad instalada acá nos permite desafiar y buscar otros proyectos que permitan traer otras tecnologías y otros productos a la región. Este fue un fit perfecto, es una vacuna o una tecnología de mRNA innovadora y en un proyecto empujado y promocionado por OMS, por MPP y por PAHO. Esto no es un proyecto, esto es un programa, esto es un inicio de un camino largo que nos va a traer, si Dios quiere, muchas opciones y muchas vacunas para la región. Creo que esta tecnología nos abre un gran campo de trabajo futuro y sin duda tiene que impactar fuertemente en la situación sanitaria de las Américas y que todo el mundo tenga acceso a las vacunas.
Vaccination Week in the Americas have been celebrated for 20 years. It's an annual celebration that aims to promote equity and access to vaccination for all people, no matter where they live or their socioeconomic situation. Everybody has the right to health, to vaccines, and to a healthier life.
Porque las vacunas salvan vidas.
Aunque estemos en COVID, la vacunación no para, la vacunación continúa.
Cada año y en solo una semana, este empuje sin igual por la salud, liderado por los países y apoyado por la Organización Panamericana de la Salud, logra vacunar alrededor de 50 millones de personas.
El desafío es grande porque nos trazamos metas.
A principal dificuldade são as distâncias.
Que los niños de nuestro país no vayan a morir por una enfermedad prevenible.
La forma de llegar a la casa y llegarle al usuario es muy importante.
Y se espera con ansias.
Hoy en día sé que es importante la vacuna.
Es muy importante vacunar a nuestros niños para el bien de nuestra familia.
Me tomo el tiempo de llevar a mi hijo a vacunar. Eso se llama responsabilidad y tenerle amor a sus hijos.
Cada uno de nosotros puede hacer algo. Tenemos que hacer nuestra parte.
Es lo más lindo que me pasó. Hago con mucho cariño, con mucho empeño mi trabajo y me gusta mucho.
Eu me sinto muito honrada de trabalhar porque eu sei que é programa que você tem resultados.
La salud no espera. Vacunémonos.
Vacúnate.
Uno todos los días está luchando para que nuestra población esté sana.
Por el bien de todos, en las Américas y en el mundo,
las vacunas son muy seguras y efectivas. Esta iniciativa se ha convertido en un ejemplo magnífico de lo que puede suceder cuando los países trabajan juntos.
Sabemos que una población sana es una garantía para un país fuerte.
Vaccination Week in the Americas demonstrates the political commitment of countries toward their immunization programs. Thanks to the joint efforts from more than 40 countries and their partners. In the past 20 years, more than 1 billion people have been vaccinated during Vaccination Week in the Americas, and different diseases have been eradicated in our region. Thanks to health workers, people in every corner get vaccinated. Today, we celebrate 20 years of Vaccination Week in the Americas. Are you fully vaccinated? Get all your shots.
¿Sabía que 1/3 de los presupuestos de salud se destina a la compra de medicamentos? Altos costos, calidad insuficiente y productos poco disponibles en el mercado, además, pueden representar una carga extra para los presupuestos de salud y amenazar la sostenibilidad del sistema. Por eso, y a pedido de los países de las Américas, la Organización Panamericana de la Salud creó el Fondo Estratégico en el año 2000. El fondo es un mecanismo solidario para la compra conjunta de medicamentos e insumos de salud pública de calidad. consolida la demanda de múltiples países, convoca a licitaciones internacionales y obtiene precios reducidos al adquirir grandes volúmenes del mismo producto. También apoya a los países para mejorar la planificación de la demanda y evitar desabastecimientos. ¿Qué productos se pueden adquirir? Más de 250, desde tratamientos para diversas enfermedades, transmisibles, no transmisibles y desatendidas, hasta equipos médicos, insumos y kits de diagnóstico. El Fondo Estratégico ofrece líneas de créditos a los países que lo necesiten a través de su cuenta de capitalización. El uso del fondo genera ahorros en los presupuestos de salud. En solo un año, un país ahorró $13 millones en la compra de medicamentos para VIH-Sida y tuberculosis. Todos los productos adquiridos a través del fondo son seguros, eficaces y de calidad garantizada. Para utilizar el fondo, los países, a través de sus ministerios de salud, deben firmar un convenio con la OPS. ¿Por qué hacerlo? Porque más y mejor acceso a medicamentos e insumos es clave para garantizar la salud para todas las personas en todas partes. Para conocer más, ingrese a www.pajo.org/Fondo Estratégico.
Hello, Paula.
Buenos dias.
Bom dia.
Hola.
Oi.
Buenos dias. Oi.
É um prazer te conhecer. O que você gostaria de falar hoje?
Beber álcool pode causar câncer?
Há uma forte ligação entre o álcool e as doenças crônicas, particularmente o câncer.
How can I make sure I drink responsibly?
I'm sorry to say, but there's no such thing as responsible drinking.
¿Cómo sé si estoy bebiendo demasiado?
Puedo ayudarte a evaluar si lo que bebes puede causarte daños.
Hi, I'm Paula. I'm the Pan American Health Organization's first digital health specialist on alcohol use. I was built to provide reliable information about the impact alcohol can have on your health. I can also help you check if your drinking is putting your health at risk and guide you through a plan to cut back. Do you think you could benefit from drinking less?
I know I would. Can you please help me?
I'd love to help you. And I promise I won't judge. I'm a digital person after all. I don't know how to judge.
Did you know that 1/3 of health budgets are used to purchase medicines? High costs, insufficient quality, and hard-to-source products in the market are major barriers to access medicines and threaten the sustainability of the system. For this reason, and at the request of the countries of the Americas, The Pan American Health Organization in 2000 created the Strategic Fund. The fund is a mechanism for pooled procurement of quality medicines and public health supplies. It pools the demand of multiple countries, executes international tenders, and achieves reduced prices when purchasing large volumes of the same product. It also supports countries to improve demand planning and prevent stockouts of medicines and health supplies. What products can be purchased? More than 250, from treatments for various diseases, communicable diseases, non-communicable diseases, and neglected diseases, to medical devices, supplies, and diagnostic kits. The Strategic Fund provides lines of credit for countries when needed through its capital account. The use of the fund allows savings in health budgets. In just 1 year, one country saved $13 million in the procurement of medicines for HIV/AIDS and tuberculosis. All products procured through the Strategic Fund are safe, effective, and quality assured. To use the fund, countries through their ministries of health need to sign an agreement with PAHO. Why do this? Because improving access to medicines and supplies is key to guaranteeing health for all, everywhere. To learn more, visit www.paho.org/strategic fund.
I am.
We are.
All of us.
Together.
This is who we are.
Our humanity. The hopes we share.
The struggles we face.
The stories that define us. Individually, collectively, universally.
Every person.
Family.
Community.
We are happier when we have each other.
Healthier when we stand together.
Every one of us matters.
No one should be left behind.
We all have the same fundamental right
to health and happiness.
To the care we need.
Wherever we live.
Whatever we have or do not have.
Regardless of age,
race,
language,
culture, or circumstance.
This is our mission.
We stand together with all people.
In every community, every country, throughout the hemisphere.
Because we are healthier.
Together.
We are the Pan American Health Organization, working for health for everyone, everywhere.
¿Qué van a hacer aquí ahora?
Se vamos a vacunarse.
¿Qué vacuna les van a poner?
La gripal y la varicela.
Estamos muy contentos, es la 20ª semana de la vacunación de las Américas. Hemos estado presentes en 44 países, hemos estado alcanzando 139 millones de personas y aquí en Argentina la semana de vacunación tiene muchísima relevancia porque se vive desde hace muchos años, desde que empezó en realidad, y se vive a todos los niveles, y es lo que hemos visto durante esta semana, es decir, a nivel de gran ciudad de Buenos Aires, como también provincias.
Una semana muy intensa de trabajo, de concientización, de fortalecimiento en la vacunación, articulando con Nación, obviamente, con la OPS, con la representante de la OPS, y la verdad que ha sido muy emotivo lo que hemos hecho acá en Cafayate y en Animaná.
La Semana de Vacunación de las Américas número 20 de la región de las Américas y 11 mundial por el liderazgo de la región de las Américas en vacunación. es muy importante para Argentina, siempre es muy significativo, es una fiesta, es una semana de fiesta en todo el país donde todos los integrantes del sistema de salud y los vacunadores y las vacunadoras tienen un rol enorme, pero se habla de algo que nos da mucho orgullo en Argentina, que es nuestro calendario de vacunación y la confianza que tiene la población en las vacunas. Es muy emocionante y da mucho orgullo.
Hay que continuar durante cada semana, durante cada mes, para asegurarnos que llegamos a recuperar ese calendario y con el acompañamiento del OPS estamos seguros que poco a poco iremos avanzando y lo iremos consiguiendo.
Gracias.
E Biomanguinhos foi oficializado como um instituto produtor de imunobiológicos na década de 70. Desde então, Biomanguinhos vem junto com o Ministério da Saúde, Programa Nacional de Imunizações, a Organização Pan-Americana de Saúde, a OMS, como um dos fornecedores principais de vacinas na América Latina. E neste momento, nós estamos em fase de desenvolvimento da tecnologia da vacina em RNA, nessa nova plataforma. Então, estamos detalhando os equipamentos, os rendimentos, todos os resultados que são esperados, não é só em termos de produção, como em metodologias analíticas de controle de qualidade, com o intuito de, no próximo ano, já termos as primeiras etapas de escalonamento e produção, visando os estudos clínicos necessários para essa vacina.
Synergium Biotech es una empresa de biotecnología aquí en Argentina y nos dedicamos a la producción de vacunas principalmente y otros productos biotecnológicos. Synergium Biotech tiene ya hace 2 años una participación en el Fondo Rotatorio de la Organización Panamericana de la Salud con la vacuna antigripal justamente, y tener esta capacidad instalada acá nos permite desafiar y buscar otros proyectos que permitan traer otras tecnologías y otros productos a la región. Este fue un fit perfecto, es una vacuna o una tecnología de mRNA innovadora y en un proyecto empujado y promocionado por OMS, por MPP y por PASCO. Esto no es un proyecto, esto es un programa, esto es un inicio de un camino largo que nos va a traer, si Dios quiere, muchas opciones y muchas vacunas para la región. Creo que esta tecnología nos abre un gran campo de trabajo futuro y sin duda tiene que impactar fuertemente en la situación sanitaria de las Américas y que todo el mundo tenga acceso a las vacunas.
Vaccination Week in the Americas have been celebrated for 20 years. It's an annual celebration that aims to promote equity and access to vaccination for all people, no matter where they live or their socioeconomic situation. Everybody has the right to health, to vaccines, and to a healthier life.
Porque las vacunas salvan vidas.
Aunque estemos en COVID, la vacunación no para, la vacunación continúa.
Cada año y en solo una semana, este empuje sin igual por la salud, liderado por los países y apoyado por la Organización Panamericana de la Salud, logra vacunar alrededor de 50 millones de personas.
El desafío es grande porque nos trazamos metas.
A principal dificuldade são as distâncias.
Que los niños de nuestro país no vayan a morir por una enfermedad prevenible.
La forma de llegar a la casa y llegarle al usuario es muy importante.
Y se espera con ansias.
Hoy en día sé que es importante la vacuna.
Es muy importante vacunar a nuestros niños para el bien de nuestra familia.
Me tomo el tiempo de llevar a mi hijo a vacunar. Eso se llama responsabilidad y tenerle amor a sus hijos.
Cada uno de nosotros puede hacer algo. Tenemos que hacer nuestra parte.
Es lo más lindo que me pasó. Hago con mucho cariño, con mucho empeño mi trabajo y me gusta mucho.
Eu me sinto muito honrada de trabalhar, porque eu sei que é programa que você tem resultados.
La salud no espera. Vacunémonos.
Vacúnate.
Uno todos los días está luchando para que nuestra población esté sana.
Por el bien de todos, en las Américas y en el mundo,
las vacunas son muy seguras y efectivas. Esta iniciativa se ha convertido en un ejemplo magnífico de lo que puede suceder cuando los países trabajan juntos.
Sabemos que una población sana es una garantía para un país fuerte.
Vaccination demonstrates the political commitment of countries toward their immunization programs. Thanks to the joint efforts from more than 40 countries and their partners. In the past 20 years, more than 1 billion people have been vaccinated during Vaccination Week in the Americas, and different diseases have been eradicated in our region. Thanks to health workers, people in every corner get vaccinated. Today, we celebrate 20 years of Vaccination Week in the Americas. Are you fully vaccinated? Get all your shots.
¿Sabía que 1/3 de los presupuestos de salud se destina a la compra de medicamentos? Altos costos, calidad insuficiente y productos poco disponibles en el mercado, además, pueden representar una carga extra para los presupuestos de salud y amenazar la sostenibilidad del sistema. Por eso, y a pedido de los países de las Américas, la Organización Panamericana de la Salud creó el Fondo Estratégico en el año 2000. El fondo es un mecanismo solidario para la compra conjunta de medicamentos e insumos de salud pública de calidad. consolida la demanda de múltiples países, convoca a licitaciones internacionales y obtiene precios reducidos al adquirir grandes volúmenes del mismo producto. También apoya a los países para mejorar la planificación de la demanda y evitar desabastecimientos. ¿Qué productos se pueden adquirir? Más de 250, desde tratamientos para diversas enfermedades, transmisibles, no transmisibles y desatendidas, hasta equipos médicos, insumos y kits de diagnóstico. El Fondo Estratégico ofrece líneas de créditos a los países que lo necesiten a través de su cuenta de capitalización. El uso del fondo genera ahorros en los presupuestos de salud. En solo un año, un país ahorró $13 millones en la compra de medicamentos para VIH-Sida y tuberculosis. Todos los productos adquiridos a través del fondo son seguros, eficaces y de calidad garantizada. Para utilizar el fondo, los países, a través de sus ministerios de salud, deben firmar un convenio con la OPS. ¿Por qué hacerlo? Porque más y mejor acceso a medicamentos e insumos es clave para garantizar la salud para todas las personas en todas partes. Para conocer más, ingrese a www.pajo.org/Fondo Estratégico.
Hello, Paula.
Buenos días.
Bom dia.
Hola.
Oi.
Buenos dias.
Oi.
É um prazer te conhecer. O que você gostaria de falar hoje?
Beber álcool pode causar câncer?
Há uma forte ligação entre o álcool e as doenças crônicas, particularmente o câncer.
How can I make sure I drink responsibly?
I'm sorry to say, but there's no such thing as responsible drinking.
¿Cómo sé si estoy bebiendo demasiado?
Puedo ayudarte a evaluar si lo que bebes puede causarte daños.
Hi, I'm Paula. I'm the Pan American Health Organization's first digital health specialist on alcohol use. I was built to provide reliable information about the impact alcohol can have on your health. I can also help you check if your drinking is putting your health at risk and guide you through a plan to cut back. Do you think you could benefit from drinking less?
I know I would. Can you please help me?
I'd love to help you. And I promise I won't judge. I'm a digital person after all. I don't know how to judge.
A menos que me decida a caminar, camino directo a la roja, pero ahora tengo el tiempo mejor, no puedo. It's really just looked at a laptop and I'm so happy because I'm looking for you all day. I thought there is nothing. Yeah.
Did you know that 1/3 of health budgets are used to purchase medicines? High costs, insufficient quality, and hard-to-source products in the market are major barriers to access medicines and threaten the sustainability of the system. For this reason, and at the request of the countries of the Americas, The Pan American Health Organization in 2000 created the Strategic Fund. The fund is a mechanism for pooled procurement of quality medicines and public health supplies. It pools the demand of multiple countries, executes international tenders, and achieves reduced prices when purchasing large volumes of the same product. It also supports countries to improve demand planning and prevent stockouts of medicines and health supplies. What products can be purchased? More than 250, from treatments for various diseases, communicable diseases, non-communicable diseases, and neglected diseases, to medical devices, supplies, and diagnostic kits. The Strategic Fund provides lines of credit for countries when needed through its capital account. The use of the fund allows savings in health budgets. In just 1 year, one country saved $13 million in the procurement of medicines for HIV/AIDS and tuberculosis. All products procured through the Strategic Fund are safe, effective, and quality assured. To use the fund, countries through their ministries of health need to sign an agreement with PAHO. Why do this? Because improving access to medicines and supplies is key to guaranteeing health for all, everywhere. To learn more, visit www.paho.org/strategic fund.
I am.
We are.
All of us. Together.
This is who we are.
Our humanity. The hopes we share.
The struggles we face.
The stories that define us.
Individually, collectively, universally.
Every person.
Family.
Community.
We are happier when we have each other.
Healthier when we stand together.
Every one of us matters.
No one should be left behind.
We all have the same fundamental right
to health and happiness.
To the care we need.
Wherever we live.
Whatever we have or do not have.
Regardless of age,
race,
language,
culture, or circumstance.
This is our mission.
We stand together with all people.
In every community, every country, throughout the hemisphere.
Because we are healthier.
Together.
We are the Pan American Health Organization, working for health for everyone, everywhere.
¿Qué van a hacer aquí ahora?
¡Se vamos a vacunarse!
¿Qué vacuna les van a poner?
La gripal y la varicela.
Estamos muy contentos, es la 20ª semana de la vacunación de las Américas. Hemos estado presentes en 44 países, hemos estado alcanzando 139 millones de personas y aquí en Argentina la semana de vacunación tiene muchísima relevancia porque se vive desde hace muchos años, desde que empezó en realidad, y se vive a todos los niveles, es lo que hemos visto durante esta semana, es decir, a nivel de gran ciudad de Buenos Aires, como también provincias.
Una semana muy intensa de trabajo, de concientización, de fortalecimiento en la vacunación, articulando con Nación, obviamente, con la OPS, con la representante de la OPS, y la verdad que ha sido muy emotivo lo que hemos hecho acá en Cafayate y en Animaná.
Las Semana de Vacunación de las Américas número 20 de la región de las Américas y 11 mundial por el liderazgo de la región de las Américas en vacunación. Es muy importante para Argentina, siempre es muy significativo, es una fiesta, es una semana de fiesta en todo el país donde todos los integrantes del sistema de salud y los vacunadores y las vacunadoras tienen un rol enorme, pero se habla de algo que nos da mucho orgullo en Argentina, que es nuestro calendario de vacunación y la confianza que tiene la población en las vacunas. Es muy emocionante y da mucho orgullo.
Hay que continuar durante cada semana, durante cada mes, para asegurarnos que llegamos a recuperar ese calendario y con el acompañamiento del OPS estamos seguros que poco a poco iremos avanzando y lo iremos consiguiendo.
E Biomanguinhos foi oficializado como um instituto produtor de imunobiológicos na década de 70. Desde então, Biomanguinhos vem junto com o Ministério da Saúde, Programa Nacional de Imunizações, a Organização Pan-Americana de Saúde, a OMS, como um dos fornecedores principais de vacinas na América Latina. E neste momento nós estamos em fase de desenvolvimento da tecnologia da vacina em RNA, nessa nova plataforma. Então estamos detalhando os equipamentos, os rendimentos, todos os resultados que são esperados, não é só em termos de produção, como em metodologias analíticas de controle de qualidade, com o intuito de, no próximo ano, já termos as primeiras etapas de escalonamento e produção visando os estudos clínicos necessários para essa vacina.
Synergium Biotech es una empresa de biotecnología aquí en Argentina y nos dedicamos a la producción de vacunas principalmente y otros productos biotecnológicos. Synergium Biotech tiene ya hace 2 años una participación en el Fondo Rotatorio de la Organización Panamericana de la Salud con la vacuna antigripal justamente, y tener esta capacidad instalada acá nos permite desafiar y buscar otros proyectos que permitan traer otras tecnologías y otros productos a la región. Este fue un fit perfecto, es una vacuna o una tecnología de mRNA innovadora y en un proyecto empujado y promocionado por OMS, por MPP y por PASCO. Esto no es un proyecto, esto es un programa, esto es un inicio de un camino largo que nos va a traer, si Dios quiere, muchas opciones y muchas vacunas para la región. Creo que esta tecnología nos abre un gran campo de trabajo futuro y sin duda tiene que impactar fuertemente en la situación sanitaria de las Américas y que todo el mundo tenga acceso a las vacunas.
Vaccination Week in the Americas have been celebrated for 20 years. It's an annual celebration that aims to promote equity and access to vaccination for all people, no matter where they live or their socioeconomic situation. Everybody has the right to health, to vaccines, and to a healthier life.
Porque las vacunas salvan vidas.
Aunque estemos en COVID, la vacunación no para. La vacunación continúa.
Cada año y en solo una semana, este empuje sin igual por la salud, liderado por los países y apoyado por la Organización Panamericana de la Salud, logra vacunar alrededor de 50 millones de personas.
El desafío es grande porque nos trazamos metas.
A principal dificuldade são as distâncias.
Que los niños de nuestro país no vayan a morir por una enfermedad prevenible.
La forma de llegar a la casa y llegarle al usuario es muy importante.
Y se espera con ansias.
Hoy en día sé que es importante la vacuna.
Es muy importante vacunar a nuestros niños para el bien de nuestra familia.
Me tomo el tiempo de llevar a mi hijo a vacunar. Eso se llama responsabilidad y tenerle amor a sus hijos.
Cada uno de nosotros puede hacer algo. Tenemos que hacer nuestra parte.
Es lo más lindo que me pasó. Hago con mucho cariño, con mucho empeño mi trabajo y me gusta mucho.
Eu me sinto muito honrada de trabalhar porque eu sei que é programa que você tem resultados.
La salud no espera. Vacunémonos.
Vacúnate.
Uno todos los días está luchando para que nuestra población esté sana.
Por el bien de todos, en las Américas y en el mundo,
las vacunas son muy seguras y efectivas. Esta iniciativa se ha convertido en un ejemplo magnífico de lo que puede suceder cuando los países trabajan juntos.
Sabemos que una población sana es una garantía para un país fuerte.
Vaccination Week in the Americas demonstrates the political commitment of countries toward their immunization programs. Thanks to the joint efforts from more than 40 countries and their partners, in the past 20 years, more than 1 billion people have been vaccinated during Vaccination Week in the Americas, and different diseases have been eradicated in our region. Thanks to health workers, people in every corner get vaccinated. Today, we celebrate 20 years of Vaccination Week in the Americas. Are you fully vaccinated? Get all your shots.
¿Sabía que 1/3 de los presupuestos de salud se destina a la compra de medicamentos? Altos costos, calidad insuficiente y productos poco disponibles en el mercado, además, pueden representar una carga extra para los presupuestos de salud y amenazar la sostenibilidad del sistema. Por eso, y a pedido de los países de las Américas, la Organización Panamericana de la Salud creó el Fondo Estratégico en el año 2000. El fondo es un mecanismo solidario para la compra conjunta de medicamentos e insumos de salud pública de calidad. consolida la demanda de múltiples países, convoca a licitaciones internacionales y obtiene precios reducidos al adquirir grandes volúmenes del mismo producto. También apoya a los países para mejorar la planificación de la demanda y evitar desabastecimientos. ¿Qué productos se pueden adquirir? Más de 250, desde tratamientos para diversas enfermedades, transmisibles, no transmisibles y desatendidas, hasta equipos médicos, insumos y kits de diagnóstico. El Fondo Estratégico ofrece líneas de créditos a los países que lo necesiten a través de su cuenta de capitalización. El uso del fondo genera ahorros en los presupuestos de salud. En solo un año, un país ahorró $13 millones en la compra de medicamentos para VIH-Sida y tuberculosis. Todos los productos adquiridos a través del fondo son seguros, eficaces y de calidad garantizada. Para utilizar el fondo, los países, a través de sus ministerios de salud, deben firmar un convenio con la OPS. ¿Por qué hacerlo? Porque más y mejor acceso a medicamentos e insumos es clave para garantizar la salud para todas las personas en todas partes. Para conocer más, ingrese a www.pajo.org/Fondo Estratégico.
Hello, Paula.
Buenos días.
Bom dia.
Hola.
Oi.
Buenos dias.
Oi.
É um prazer te conhecer. O que você gostaria de falar hoje?
Beber álcool pode causar câncer?
Há uma forte ligação entre o álcool e as doenças crônicas, particularmente o câncer.
How can I make sure I drink responsibly?
I'm sorry to say, but there's no such thing as responsible drinking.
¿Cómo sé si estoy bebiendo demasiado?
Puedo ayudarte a evaluar si lo que bebes puede causarte daños.
Hi, I'm Paula. I'm the Pan American Health Organization's first digital health specialist on alcohol use. I was built to provide reliable information about the impact alcohol can have on your health. I can also help you check if your drinking is putting your health at risk and guide you through a plan to cut back. Do you think you could benefit from drinking less?
I know I would. Can you please help me?
I'd love to help you. And I promise I won't judge. I'm a digital person after all. I don't know how to judge.
Did you know that 1/3 of health budgets are used to purchase medicines? High costs, insufficient quality, and hard-to-source products in the market are major barriers to access medicines and threaten the sustainability of the system. For this reason, and at the request of the countries of the Americas, The Pan American Health Organization in 2000 created the Strategic Fund. The fund is a mechanism for pooled procurement of quality medicines and public health supplies. It pools the demand of multiple countries, executes international tenders, and achieves reduced prices when purchasing large volumes of the same product. It also supports countries to improve demand planning and prevent stockouts of medicines and health supplies. What products can be purchased? More than 250, from treatments for various diseases, communicable diseases, non-communicable diseases, and neglected diseases, to medical devices, supplies, and diagnostic kits. The Strategic Fund provides lines of credit for countries when needed through its capital account. The use of the fund allows savings in health budgets. In just 1 year, one country saved $13 million in the procurement of medicines for HIV/AIDS and tuberculosis. All products procured through the Strategic Fund are safe, effective, and quality assured. To use the fund, countries through their ministries of health need to sign an agreement with PAHO. Why do this? Because improving access to medicines and supplies is key to guaranteeing health for all, everywhere. To learn more, visit www.paho.org/strategic fund.
I am.
We are.
All of us. Together.
This is who we are.
Our humanity. The hopes we share.
The struggles we face.
The stories that define us.
Individually, collectively, universally.
Every person,
family,
community.
We are happier when we have each other.
Healthier when we stand together.
Every one of us matters.
No one should be left behind.
We all have the same fundamental right
to health and happiness.
To the care we need.
Wherever we live.
Whatever we have or do not have.
Regardless of age,
race,
language,
culture, or circumstance.
This is our mission.
We stand together with all people.
In every community, every country, throughout the hemisphere.
Because we are healthier.
Together.
We are the Pan American Health Organization, working for health for everyone, everywhere.
¿Qué van a hacer aquí ahora?
¿Qué vamos a vacunarse?
¿Qué vacuna les van a poner?
Amiga principal y la varicela.
Estamos muy contentos, es la 20ª Semana de la Vacunación de las Américas. Hemos estado presentes en 44 países, hemos estado alcanzando 139 millones de personas y aquí en Argentina la semana de vacunación tiene muchísima relevancia porque se vive desde hace muchos años, desde que empezó en realidad, y se vive a todos los niveles, y es lo que hemos visto durante esta semana, es decir, a nivel de gran ciudad de Buenos Aires, como también provincias.
Una semana muy intensa de trabajo, de concientización, de fortalecimiento en la vacunación, articulando con Nación, obviamente, con la OPS, con la representante de la OPS, y la verdad que ha sido muy emotivo lo que hemos hecho acá en Cafayate y en Animaná.
la Semana de Vacunación de las Américas, número 20 de la región de las Américas y 11 mundial por el liderazgo de la región de las Américas en vacunación. Es muy importante para Argentina, siempre es muy significativo, es una fiesta, es una semana de fiesta en todo el país donde todos los integrantes del sistema de salud y los vacunadores y las vacunadoras tienen un rol enorme, pero se habla de algo que nos da mucho orgullo en Argentina, que es nuestro calendario de vacunación y la confianza que tiene la población en las vacunas. Es muy emocionante y da mucho orgullo.
Hay que continuar durante cada semana, durante cada mes, para asegurarnos que llegamos a recuperar ese calendario y con el acompañamiento del OPS estamos seguros que poco a poco iremos avanzando y lo iremos consiguiendo.
Literally, oh, down there? They were like, yeah, actually, we're refunding the $44 from the second. One of them right there. I know he would know what they're actually. He's in the grade third.
E Biomanguinhos foi oficializado como um instituto produtor de imunobiológicos na década de 70. Desde então, Biomanguinhos vem junto com o Ministério da Saúde, Programa Nacional de Imunizações, a Organização Pan-Americana de Saúde, a OMS, como um dos fornecedores principais de vacinas na América Latina. E neste momento, nós estamos em fase de desenvolvimento da tecnologia da vacina em RNA, nessa nova plataforma. Então, estamos detalhando os equipamentos, os rendimentos, todos os resultados que são esperados, não é só em termos de produção, como metodologias analíticas de controle de qualidade, com o intuito de, no próximo ano, já termos as primeiras etapas de escalonamento e produção, visando os estudos clínicos necessários para essa vacina.
He said he'd be here for
Synergium Biotech es una empresa de biotecnología aquí en Argentina y nos dedicamos a la producción de vacunas principalmente y otros productos biotecnológicos. Synergium Biotech tiene ya hace 2 años una participación en el fondo rotatorio de la Organización Panamericana de la Salud con la vacuna antigripal justamente, y tener esta capacidad instalada acá nos permite desafiar y buscar otros proyectos que permitan traer otras tecnologías y otros productos a la región. Este fue un fit perfecto, es una vacuna o una tecnología de mRNA innovadora y en un proyecto empujado y promocionado por OMS, por MPP y por PASCO. Esto no es un proyecto, esto es un programa, esto es un inicio de un camino largo que nos va a traer, si Dios quiere, muchas opciones y muchas vacunas para la región. Creo que esta tecnología nos abre un gran campo de trabajo futuro y sin duda tiene que impactar fuertemente en la situación sanitaria de las Américas y que todo el mundo tenga acceso a las vacunas.
Vaccination Week in the Americas have been celebrated for 20 years. It's an annual celebration that aims to promote equity and access to vaccination for all people, no matter where they live or their socioeconomic situation. Everybody has the right to health, to vaccines, and to a healthier life.
Porque las vacunas salvan vidas.
Aunque estemos en COVID,
Nos exprimen hasta la
That's fine. That's fine. I just you don't want to do that. Oh, gotcha. Yeah, it's not. All right. We don't want that. I got quick question. Yeah. So if the stream
You said you're gonna give it.
oh, it's not.
Yeah.
Oh, hey,
Buenas tardes.
Good afternoon. We have a quorum. We have our head table full, and so let us reconvene with the afternoon session. Thank you very much. You have the floor, Mr. President. Good afternoon, everyone. So we continue with today's session, the continuation with the afternoon session. As you will recall, we were considering agenda item 4.5, strategic communications and public health for behavior change. We were about to give the floor to Dr. Garcia Saizo in order to answer to the various comments and questions addressed to him. Thank you very much, Mr. President. First and foremost, I'd like to thank each and every one of the comments that have been voiced in this discussion. No doubt that they do contribute to a concept note that attempts to enshrine a complex concept as well as an innovative concept in our region. Something that we ought to consider because of the potential it offers in the strengthening of our actions in public health. I do wish to thank everyone for the comments made from the unique point of view offered by the document in connection with infodemics as a concept that goes far beyond fake news, where it implies overabundance of information to which we're all exposed, each and every one of us, and which also shows the importance of moving towards the possibility of better understanding the phenomenon and acting decisively on this one. Obviously, also the importance of linking academic centers that have experience and that have done work in connection with this issue, and in particular in connection with this behavior, and how to have an influence from the feedback proposals in public policies, and that our region is no exception, and that we have well-known centers in our countries that undoubtedly have contributed and will continue to contribute so that this will go beyond what is merely a concept known nowadays. And also, we take note of each and every one of the comments that entail a strengthening of the document towards the future, and thinking about this, which is a collective build with each and every one of the member states, where we believe that it is not only limited to this concept note, but the construction of a path that will enable us to take care of this problem with a better capacity with our eyes in the future. Without further ado, I believe that taking into account this note and being able to contribute with these comments, we can work on a new version, a version that will reflect this and then be submitted to the executive committee. Thank you very much. That is all, sir. Very good, distinguished director. Any comments? Thank you. Thank you, Mr. President. I would also like to add my voice to the comments voiced by Director Sebastian Garcia. First of all, I'd like to thank member states for their contributions. This proposal was a suggestion by the Minister of Jamaica. I don't know whether you all recall, but during the Pan American Sanitary Conference, I was not present in the room at the time. I wasn't able to be there, but I acknowledge that this was a concern voiced by Minister Tefton, precisely because of all that you discussed on an issue that is nothing new, but that it is an innovative approach, because during the pandemic, besides responding with public health measures, we see more and more the need for including a new way of establishing communication, a communication that will not only be communication of scientific facts on public health, but a much more strategic communications taking into account the expertise that exists in many other areas outside the health sector in order to be able to respond and meet the challenges posed by infodemics and fake news, which greatly contributed to misinformation during the pandemic, and that now, unfortunately, there is some evidence and some data showing that this is also reflected, for example, in our routine immunization. So in spite of being a novel, innovative approach, and with the contributions made here by many member states, we will now be able to polish this document, which will become an important document to be considered by our directing council. So thank you very much.
Gracias, director.
Thank you, Director. We ask the rapporteur to be kind enough to introduce the proposed resolution. Thank you. Draft resolution, proposed resolution, strategic communications and public health for behavior change. The 172nd Executive Committee, PP, having reviewed the concept paper, Strategic Communications and Public Health for Behavior Change, document CE 172/16, resolves, OP, to recommend that the 60th Directing Council adopt a resolution along the following lines. Strategic Communications and Public Health for Behavior Change. The 60th Directing Council, PP1, having reviewed the concept paper Strategic Communications and Public Health for Behavior Change, document CD 60, PP2, taking into account the excess of information, both accurate as well as fake, that already exist on the internet and the exponential growth of information about the COVID-19 pandemic over the past 3 years. PP3, recognizing that countries of the region of the Americas have made significant progress in public information dissemination, strategic communications, and infodemic management. PP4, aware of the need to strategically update, develop, and better integrate policies and programs for behavior change in the health sector, informed by the behavioral sciences. PP5, considering that strategic communications to promote behavior change are key in the construction of resilient national health systems based on renewed and strengthened primary health care. PP6, recognizing that the pandemic has increased skepticism toward public health information and that higher levels of trust are necessary to increase the uptake of desired health behavior, resolves. OP1, to approve the concept paper Strategic Communications and Public Health for Behavior Change, document CD 60/OP2, to urge member states, considering their context, needs, vulnerabilities, and priorities, to A, recognize that the need to strengthen strategic communication initiatives and behavioral science programs in the region. B, incorporate the concept of behavioral science in health as a cornerstone of health systems resilience. C, strengthen the health components of behavioral science programs, especially big data analytics, online social behavior, infodemic management, scientific communications, health information management, public information dissemination, including through social media, and digital literacy, and facilitate their integration into the implementation of public health policies and practices. D, promote the social participation in the development of communication strategies in order to increase public trust and customize the messages to specific contexts and populations. E, utilize multi-stakeholder and interdisciplinary mechanisms to share lessons learned and good practices in strategic communications and infodemic management programs implemented by governments and institutions throughout the region, in particular during the pandemic. OP3, to request the director to A, support institutional, interinstitutional, multi-stakeholder, and interdisciplinary efforts to apply the behavioral sciences in public health, recognizing the particular context of member states in the region and taking into account that there are many ways to produce, manage, and disseminate evidence-based information. B, provide technical cooperation to member states on strategic communications to promote behavior change as a priority work area on the path toward universal health coverage in the region. C, promote the systematic production of customized and contextualized information so that people and societies have a greater understanding of public health issues and the capacity to make more accurate decisions regarding their own health. D, promote the dissemination of lessons learned and good practices for strategic communications for behavior change in public health based on progress made in the region and at a global level. So that would be all. Thank you, sir.
Gracias.
Thank you to the rapporteur, distinguished delegate of Bolivia. And now we offer the floor to the plenary. Floor is open for comments.
No hay intervenciones. Sí hay intervenciones.
Yes, there are some requests for the floor. The U.S. Delegate, please.
Thank you very much. As we mentioned in our earlier intervention, we'd like to make one suggestion to terminology in the text. This would be in PP2 to replace the word fake with the terms false, inaccurate, or misleading, which together form the definition of misinformation. So this would just be to add some clarity and nuance to the terminology there. So again, it would be replacing in PP2 the word fake with the terms false, inaccurate, or misleading. Thank you.
Gracias, delegada.
Thank you, distinguished delegate of the U.S.
Sí, bueno, les pido esperar unos minutos.
I ask you to bear with us for a couple of seconds. Oh, the translation is ready. Oh, this is really fast.
Brasil, por favor.
Presidente,
Brazil. Mr. President, in connection with the suggestion that we had made to the effect of creating a forum for the exchange of experiences, it is not necessary to include it in the text of the resolution. We would be pleased if it simply appears in the minutes of the meeting. Thank you, sir.
Okay, de acuerdo.
Okay, in agreement. Thank you. Thank you, Brazil.
Entonces, si todos estamos de acuerdo.
If we all agree and we don't have any additional comments, we give the floor to the rapporteur once again so that he can read out this last part, which is the amendment proposed by the U.S. Thank you, sir. So the resolution would reflect this change in PP2, taking into account the excess of information that already exists on the Internet, including accurate, false, inaccurate, or misleading, that already exist on the Internet, and the exponential growth of information about the COVID-19 pandemic over the past 3 years. That would be the change, Mr. President, including false, inaccurate, or misleading. Thank you. No additional comments and no objections? No objections. We all agree. We all seem to be in agreement. Is that correct? Is that it?
Sí, claro. No, yo iba a decir, yo pensé que me...
I was about to say that you will not give me the possibility of using the gavel. I couldn't do it last time because it was a last-minute thing. So we approved this resolution. I can use the gavel now.
Continuamos con el punto 4.
So we move on to 4.6, Strategy for Improving Mental Health and Suicide Prevention in the Region of the Americas. I bring to the attention of the committee document CE 172/17, and I invite Dr. Anselm Hennis, Director of Non-Communicable Diseases and Mental Health Department of the Pan American Sanitary Bureau, to please come up to the head table to introduce this agenda item.
Honorable President and distinguished delegates of the 172nd Executive Committee, Dr. Barbosa, Director of the Pan American Health Organization. Thank you for the opportunity to present the strategy for improving mental health and suicide prevention in the region of the Americas. Although mental, neurological, and substance use conditions are a significant source of morbidity and mortality in the Americas, as many as 90% of people living with these conditions do not receive the required care. Additionally, the prevalence of suicide, which claims nearly 100,000 lives each year in the Americas, has increased over the past 2 decades, in stark contrast to all other WHO regions where similar prevalences have declined. While the COVID-19 pandemic has led to increased rates of mental health conditions, disruptions in essential mental health services have limited availability and access to care when they have been needed the most, particularly for those living in vulnerable situations. Recognizing the ongoing mental health impacts of the pandemic on the region, in May of 2022, Pan American Health Organization launched a high-level commission on mental health and COVID-19 to provide guidance to the organization on strengthening mental health systems and services during and after the pandemic. The high-level commission recently launched its report titled A New Agenda for Mental Health in the Americas in June 2023. The strategy for improving mental health and suicide prevention in the region of the Americas builds on the existing policy for improving mental health based on concrete actions for building back better mental health, and it also incorporates recommendations of the High-Level Commission on Mental Health and COVID-19, including the inclusion of mental health as an integral part of universal health access and coverage, the importance of digital health solutions to extend services, the participation of Afro-descendant and indigenous populations and those living in vulnerable situations in advancing mental health, and critically, prioritizing the prevention of suicide. This strategy aims to guide and support countries in the region in improving mental health and suicide prevention, using an equity and human rights-based approach through 6 strategic lines: build mental health leadership, governance, and multi-sectoral partnerships, and integrate mental health in all policies, improve the availability, accessibility, and quality of community-based services for mental health conditions, and support the advancements of deinstitutionalization, advance mental health promotion and prevention strategies and activities throughout the life course, reinforce the integration of mental health and psychosocial support, MHPSS, in emergency contexts, make suicide prevention a national whole-of-government priority, and build multi-sectoral capacity to respond to people affected by suicidal behaviors. And finally, strengthen the systematic collection and reporting of mental health data, evidence, and research. We thank Member States for their invaluable contributions to the consultation process, which took place at the beginning of this year. We invite the Executive Committee to review and approve this strategy and its recommendations. Thank you for your attention.
Thank you, Dr. Hennis. Now we open up the floor for debate.
Bueno, la delegada.
The delegate from Uruguay, followed by Argentina, Brazil. You have the floor, sir, or ma'am. Thank you very much, Mr. President. We are grateful for this document, a strategy for improving mental health and suicide prevention in the region of the Americas, the COVID-19 pandemic, but with it, the worsening of mental health disorders that had already existed, and this was just a trigger for others to emerge. Suicide is one of the main public health problems in my country, Uruguay. Therefore, or given the high levels that have existed for a long time. The records for attempted suicide in 2022, there was a new law that made it mandatory to report on attempted suicides through a form that was made available and this has to be filled out by public and private health centers. This new means of mandatory record keeping, something that has to be filled out within a 24-hour time period online. And there's a key that makes it possible to identify who the health provider is and to track compliance with that protocol. In coordination with the programmatic area for mental health care, on a daily basis, we follow up on each case by telephone and each provider to make sure that the national protocol that's been instituted is complied with. So having this information in real time and doing this throughout the country makes it possible for us to have a clear understanding of what the current situation of suicide is in our country so that we can work on improving mental health. It's very important for us to undertake this work with contributions of society such that we can have an understanding of what's happening on the ground and understand the actual traits or characteristics of each location. Now, having human resources and given the shortage of human resources at each location, telemedicine is a very important tool with which to train HR at the first level of care. This doesn't always allow for in-person psychiatric assistance. It does give us a first opportunity to offer care. Another important point is addressing the issue of stigmatization associated with suicide. We have to come up with a communication strategy that works on cultural changes as needed. Raising awareness amongst society and doing away with prejudices. The assumption, for example, that people with mental health problems are necessarily violent. So this enables us to strengthen multi-sector collaboration for a better approach to drive and implement throughout one's life different implementations and to make better decisions in public policy in the short, mid, and long term, which is something which we think is very important. Thank you. Thank you. We give the floor to the delegate from the U.S.
Muchas gracias, señor presidente.
Thank you very much. The U.S. Thanks, PAHO, for developing this strategy for improving mental health and suicide prevention in the region of the Americas. We support progress made in public health and suicide prevention as a key component of universal health coverage. We appreciate the fact that this document places a priority on offering support to vulnerable people and those groups which have been historically marginalized, especially LGBTQI persons, women, girls, children, adolescents, the elderly, persons with disabilities, and indigenous populations. The use of evidence-based practices is something we appreciate, following the 6 lines of action of this strategy, recognizing the impact that the COVID-19 pandemic has had on healthcare workers. We recommend placing greater emphasis on bringing down barriers and the stigma associated with being a healthcare worker. That is, those who seek out health and to offer assistance, and also those who consume certain substances. The United States is grateful for the assistance given by PAHO to member states to address mental health conditions with a focus on equity. Thank you very much.
Gracias al delegado de Estados Unidos.
I thank the U.S. delegate. We give the floor now to the delegate from Argentina. Thank you very much, Mr. President. We would also like to thank Dr. Ginnes for presenting this item. Argentina is aware of the alarming rise and worsening of mental health problems during the pandemic, and that's why we have strengthened our national strategy from a comprehensive health approach, strengthening the mental health component in our overall health improvements, creating a mental health mechanism for coordinating assistance and through different protocols and specific plans for workers in the healthcare system. Within this federal system, we have prioritized mental health, doubling the budget so that we can have a community-based and cross-cutting intersectoral approach with a rights perspective, fighting against disease, promoting health and offering protection regarding suicide prevention. Our country does have a comprehensive approach in its program, which seeks to intervene early and that there be a network of care. And we also enhance those records kept about attempted suicide. There's also a national mental health law. We also commend the publication of the final report on mental health and COVID-19 as a tool with which to strengthen mental health in the region and to raise awareness. We're very grateful to PAHO for its commitment to the subject matter, and we encourage all member states to prioritize mental health on their health agendas and that they allocate resources to enhance mental health care. I take this opportunity to remind everyone that in October this year, we will host the 5th World Meeting on mental health on all policies. The summit of 2023 seeks to include mental health in all policies, including mental health policies and psychosocial assistance in the mandates and budgets, and to develop actions that focus on the social determinants of mental health and to strengthen measures that promote access to the healthcare system according to that be more of a community approach as opposed to centers that only focus on locking up people with mental health conditions. Finally, we support the draft resolution as proposed to advance the 6 strategic pillars: ethnicity, human rights, gender, equity, and others. Thank you very much, Argentina. We give the floor to Brazil. Mr. President, I would like to express thanks for this report that addresses the strategy to improve mental health and suicide prevention in the region of the Americas. Understanding the negative effect that the COVID-19 has had on the mental health of society at large, and the need for us to prioritize this subject matter based on equity and human rights. Given the importance of there being a mental health system that prioritizes the inclusion and respect and autonomy and dignity of individuals, our mental health policy is rooted in a commitment to deinstitutionalizing people and focusing on human rights. We understand that the high rate of mental health problems and the growth of suicide rates makes mental health a serious public health problem for countries of the region. Regarding this draft we have before us, I would like to support the approval in Annex A of the text in Annex A, and I take this opportunity to, just like we did in prior interventions, to request for clarification by the Secretariat regarding what would the source of additional forecast funds be in the annex of this draft, and what the approaches or priorities to be followed ought to be for us to carry this cooperation forward. Thank you. Thank you, Brazil. We give the floor to the delegate from Jamaica.
Thank you, Chair. As this is the first time my delegation is taking the floor, let me commend you on your chairmanship. Jamaica commends the Pan American Health Organization for developing the strategy for improving mental health and suicide prevention. to guide and support member states in the implementation of the policy for improving mental health adopted at the 30th Pan American Sanitary Conference. We recognize the 6 strategic lines of actions and note these are in keeping with our own efforts to advance the national mental health agenda, which has transformed based on the psychosocial impact of the pandemic. Regarding strategic line of action 1, Jamaica has a national mental health strategic plan 2020 to 2025, which describes the steps to be taken to address the mental health of Jamaicans over the next 5 years. The plan was developed through a process of stakeholder meetings and deliberations aimed at achieving as much consensus as possible. The whole of government approach articulated within this plan recognizes that many of the determinants of good mental health and mental illness are influenced by factors beyond the health system. We have also taken steps to integrate substance use policy and related legislation into the National Mental Health Policy currently being revised and the current Mental Health Act. With respect to strategic line of action 2, Jamaica is currently involved in community training of trainers. Trainers will equip other community-based workers in other program areas to provide mental health support at the community level. Another PAHO initiative being undertaken in Jamaica is a Problem Management Plus pilot project, which seeks to train community workers to assist members of the community to develop problem-solving skills to overcome challenges or adverse situations. In keeping with Strategic Line of Action 3, we are working on increasing our prevention and promotion activities in schools under the School Mental Health Literacy Program. Also, a comprehensive assessment of child and adolescent mental health services will be embarked on with a view to strengthening the existing services. Jamaica has formed an intersectoral mental health psychosocial support technical working group, which is currently collecting data on the mental health and psychosocial resources and services available island-wide. This is fundamental to identifying existing gaps, taking steps to address those gaps, and for the technical working group to execute its ultimate goal of coordinating mental health and psychosocial support in emergency contexts. Jamaica is also implementing an electronic health record being developed under a Health Services Strengthening Program supported by the IDB and the inclusion of mental health services in Phase 1, which will facilitate continuity of patient care and facilitate data collection and analysis that will further strengthen the service. We recognize the need for greater financing and prioritization of mental health in order to address resource constraints and eliminate the stigma and discrimination that continue to undermine the region's efforts. We therefore welcome this strategy and stand in support of the resolution for its adoption by the 60th Directing Council. Thank you.
Gracias.
I thank the delegate from Jamaica. We give the floor to the delegate from Suriname.
Thank you, Mr. Vice President. Suriname would like to thank the Secretariat and Mr. Hens for the joint efforts for this strategy. The purpose of this strategy is to guide and support member states of the PAHO to improve mental health and suicide prevention using an equity and human rights-based approach in order to advance health and development in the region in the context of COVID-19 pandemic, recovery, and potential future emergencies. The post-COVID-19 circumstances in Suriname regarding the mental health and suicide prevention burden and treatment gap do not particularly differ from the rest of the region. Mental health is one of the priority areas within our health sector. We have a national mental health plan and a national suicide prevention and intervention plan. We do have a mental health hospital and are offering bachelor and master studies in psychology. Several associations, such as the Associations of Psychologists, Association of Social Workers, and Associations of Epilepsy, are working very closely in tackling the mental health and suicide problems. The 6 strategic lines of action to be implemented over a 7-year frame. With technical assistance of PAHO will help Suriname to further improve its action towards mental health and suicide. Thank you, Mr. Vice President.
Okay.
I thank the delegate from Suriname. We give the floor to the delegate from Cuba. Thank you very much, Mr. President. Cuba is grateful for the presentation of the strategy to improve mental health and suicide prevention in the region of the Americas. We think that this will serve as a tool for member states with a view towards strengthening countries' capacities to improve mental health and to prevent suicide through equity, a life course, human rights focus, taking into contact the context and the priorities. The 6 lines of strategic action in this document are very close related to the plan of action of the Public Ministry of Cuba, whose actions systematically are assessed according to epidemiological situations and the situation of health in each center, which exists in each one of the health units. And this encompasses the whole population throughout their life. Different epidemiological research methods have been developed, among which the research into suicide that since 1997 until 2020, headed up by the National Department of Hygiene and Microbiology, which keeps a record of all cases of suicide and attempted suicide throughout the country, looking at different socio-demographic variables, age, sex, profession, civil society, and skin color. Furthermore, epidemiological stratification of risk was conducted according to where people live. Now, as a part of the Sustainable Development Goals of the 2030 Agenda, suicide behavior is a part of those indicators chosen for which the Cuban healthcare system has prioritized its compliance, and to this effect has set goals. They're monitored and systematically controlled in different scenarios according to the epidemiological surveillance that we have set for this. Now, suicide was included in the macro program of human development, equity, and social justice, recently headed up by the government, and that has 4 sub-programs, among which social prevention and care for vulnerabilities. That decision will make it possible for us to take stock of the results of the program, and research that's conducted on the subject matter entails all sectors of society for us to work on prevention of suicide. That's why the Health Ministry updated its 2021-2023 plan of action geared toward enhancing actions and services offered vulnerable people under the principle that suicide is preventable as long as risk factors are identified. The country has a 12.9 per 100,000 rate of suicide. That is a drop of 119 deaths relative to the prior year. When there were 16 suicides per 100,000. So we think that the aspects approached in this document offer technical tools for us to assess risk factors and to offer protection, all to redundant to the well-being of society. I thank the delegate from Cuba. Now El Salvador has the floor. Thank you very much, Mr. President. Our country recognizes the urgent need for there to be a comprehensive approach and agenda to mental health. As a part of this concern, our country has conducted the first national survey of mental health, with which we discovered some foreseeable findings in the aftermath of the pandemic, especially hitting adolescents hard, and that calls for specific interventions. The first step has been taken, which is to conduct a diagnosis, to establish a baseline, and to put into practice what these 6 strategic lines seek to do. We ask for the technical assistance for us to carry this out. We have a deficit of prepared or trained healthcare workers, and we need to make use of telemedicine and telephone systems for accessing people, preparing people in mental first aid all of this without overlooking the psychosocial well-being, health of our healthcare workers that are fully committed to the population, but that also needs to be taken into account, being mindful of the possibility of burnout, so we can make sure that they enjoy good mental health as well. Thank you, El Salvador. The delegate from Canada is recognized.
Merci. Canada firmly believes that mental health is a fundamental pillar of overall well-being, and we are committed to promoting mental wellness and supporting equitable access to quality mental health services for all individuals, including with a dedicated Minister of Mental Health. As such, we applaud PAHO's efforts toward improving the mental health of all populations and communities in the Americas, and commend the development of this strategy to guide member states, particularly as it pertains to populations in the most vulnerable situations and minority groups who are disproportionately impacted by mental health issues. We also want to recognize the important contributions of the High-Level Commission on Mental Health in COVID-19 and their report. Canada is aware of the devastating and immeasurable impact that suicide has on individuals, families, and communities. To help guide collective efforts in this regard, we do strongly support the explicit inclusion of suicide prevention as a strategic line of action in this strategy. Further, we have seen that sustained community-based investments focused on mental health promotion have the potential to improve health outcomes over the life course, and strongly agree with the strategy's emphasis on improving availability, accessibility, and quality of community-based services. It is well recognized that suicide and mental illness can affect certain population groups disproportionately, such as Indigenous populations, women, youth, and LGBTI persons. It is therefore critical to acknowledge the diversity within these populations and to support approaches developed by and tailored for them to further improve mental health outcomes, which include equity and gender equality considerations. To help guide efforts, Canada wants to emphasize the importance of disaggregated data to be able to understand specific contexts in order to effectively tackle mental health challenges and implement successful mental health promotion and suicide prevention strategies that respond to these differentiated needs. We appreciate the current iteration of this strategy and acknowledge the efforts to incorporate earlier suggestions. As work continues to solidify this piece, we would like to propose some friendly amendments to the resolution aimed at ensuring alignment with pre-agreed language and to improve clarity, and we will provide these additions in writing, Mr. President. Merci beaucoup. Thank you.
Thank you. Is there any other request for the floor? We give the floor now to Dr. Hinnis.
And thank you so much for the member states for these contributions and these inputs. And it really highlights the significant importance of mental health as a key pillar of health. There's no health without mental health. And I think we have all seen directly, we've all suffered during the pandemic in terms of all the challenges of death, misinformation, joblessness, social isolation, etc. That's come home to each and every one of us individually. The issues of pre-existing gaps in mental health came through very consistently for all the member states which spoke. It's been recognized, and I think given the fact that the demands increased significantly as a result of the pandemic, and then there are tremendous service disruptions, it really showed the fragility of mental health systems. The issues, therefore, in terms of trying to respond in terms of investing financially, and there's guidance now, particularly from the work of the Mental Health Commission, in terms of the fact that high-income countries should invest about 10% of the health budget for mental health, and low-income countries up to about 5% of their overall health budget towards mental health. These are issues that are now evidence-based that will help to guide us in the way forward. Issues of lack of access, the role of stigma and discrimination, the impact on vulnerable populations, the impact on Afro-descendant and indigenous populations, those who haven't traditionally had a voice at the table, the need to embed mental health within the context of universal access, universal health coverage, the importance of human rights, and you would have heard about the relevance of deinstitutionalization, which evolved with the Declaration of Caracas almost 20 years ago. We had great strides initially, but those advances have slowed down. And this gives us an opportunity to get back on track. The issue of using other resources to strengthen the delivery of mental health services, such as telehealth, which works so well in many situations during the pandemic. So there's so much more to do. The whole issue of equity and gender, which colleagues from Canada highlighted as being so important, and of course the importance of data. The whole issue of suicide, again, was one of the priority areas raised by the work of the High-Level Commission on Mental Health and COVID-19. And that has been one of the strategic additions to the work that we are doing. In fact, just to reiterate, in the region of the Americas, the prevalence of suicide has increased 17% in the last 2 decades, in contrast to all the other WHO regions where it has continued to decrease. So this is actually a public health crisis in our region, and we have to take this very, very seriously. There's guidance for tackling suicide, and we heard about collecting data, the change in legislation, but there are also tools, for example, the WHO Live Life Implementation Guide. So there are many tools that we need to implement and scale up. We need to get more information. We need to have policies and strategies. We need to target high-risk groups. In other words, to reverse this really worrying trend that we're seeing in the region. I'm going to respond specifically to the question raised by Brazil about the funds. And in fact, as we look at the financing for this, strategy, we can subsume it into existing finances within PAHO. But at the country level, the recommendations that countries actually identify funds, domestic funds, health funds, that allow them to scale up this strategy and implement it within countries. And I think this is going to be really very important if you're going to see any changes, the change that we're hoping to see. So I think really, I trust I've answered all the questions. There's a large body of work that needs to be done, and we look forward to accompanying you on it to take this agenda forward and reduce the burden of mental ill health, improve access, and also reduce the burden of suicide. Thank you, Mr. President.
Gracias.
Thank you, Dr. Hannes. Distinguished Director, any comments?
Thank you. I think that Director Anselm Hannes has made the very important comments about the good suggestions, comments from member states. Again, I think that's very important to highlight that first we received a couple of weeks ago the final report from the High-Level Commission on Mental Health and COVID-19, a very important initiative that was started by my predecessor, Dr. Etienne. The report has 10 very concrete suggestions that it's very important, and I'm totally committed to work with the Secretariat to transform these recommendations in a roadmap and support the countries adapting the recommendations to the national context to really implement them. These are very important recommendations that cover a very broad range of interventions from community-based service that was highlighted by the Canada delegate. It's very important. If you don't have community-based actions and interventions, multi-sectoral approach to reduce stigma and discrimination, we cannot deal with this mental health burden. If we don't prepare primary health care to deal with mental health issues, we will not be able to reduce the suicide dramatic rate that you have nowadays in our region. So I think that is really the moment to transform this very important report into actions to face the situation that we really are facing in the region. Of course, that suicide is a very complex event that probably will have different causes working together. In many countries, the rapid demographic transition that is providing, I think, that more, that is increasing the suicide rate. Is in other countries, young people that belongs to vulnerable groups, they are losing their hope and losing and seeing that they are missing the opportunities to improve their quality of life in many countries. They are still victims of discrimination, stigma, and violence. So it's a very complex issue that we are dealing, that we need this comprehensive approach in order to reduce this rate, the important rate that we have, and to increase the mental health and quality of life of our population. Thank you, Mr. President.
Gracias, director.
Thank you, Director. And now we ask the rapporteur to please introduce the proposed resolution. Thank you, Mr. President. Proposed resolution. Strategy for improving mental health and suicide prevention in the region of the Americas. The 172nd session of the Executive Committee, PP, having reviewed the proposed strategy for improving mental health and suicide prevention in the region of the Americas, document CE 172/17, resolves to recommend that the 60th Directing Council adopt a resolution in the following terms. Strategy for improving mental health and suicide prevention in the region of the Americas. The 60th Directing Council, PP1, having reviewed the strategy for improving mental health and suicide prevention in the region of the Americas, document CD60/PP2, recognizing the detrimental impact that the COVID-19 pandemic has had on the mental health of the general population, increasing the burden of mental health conditions while disrupting essential mental health services in the region. PP3, considering the strategic principles of the policy for improving mental health document CSP 30/9, and the final recommendations of the Bajo High-Level Commission on Mental Health and COVID-19, PP4, recognizing the urgent need to prioritize the mental health and suicide prevention, using an equity and human rights-based approach to accelerate recovery from the COVID-19 pandemic and work toward achieving health, social, and economic development outcomes in the region. Resolves OP1 to approve the strategy for improving mental health and suicide prevention in the region of the Americas, document CD60/OP2, to urge all member states, considering their context, needs, vulnerabilities, and priorities, to A, ensure that everyone has the opportunity to enjoy the highest possible level of health by applying an intersectoral equity and human rights-based approach to promoting and protecting mental health that includes everyone and avoids unfair differences between groups of people due to their race, ethnicity, gender identity, disabilities, socioeconomic status, sexual orientation, or geographic location, among other factors. B, increase financial and human resources for scaling up community-based mental health care to ensure that resources are proportionate to the mental health needs of each country and, where necessary, use evidence-based remote approaches to improve access to services and care. C, support the transition from long-stay mental institutions to community-based services to promote dignity and respect for people with mental health conditions and prevent abuses and violations of their rights, in line with the Convention on the Rights of Persons with Disabilities and other core human rights instruments. D, take urgent action to prevent suicide through a multi-sectoral approach that includes all relevant stakeholders, implements evidence-based interventions, and strengthens data collection efforts to inform suicide prevention policies, plans, and services from early childhood throughout the life course. OP3, to request that the Director to A, provide technical cooperation to member states to strengthen capacities that contribute to the implementation of the strategy and the achievement of its strategic lines of action. B, continue prioritizing mental health and suicide prevention and facilitating its integration into all COVID-19 recovery efforts by the Pan American Health Organization, as well as other initiatives across the organization. C, report periodically to the governing bodies on the progress made and challenges faced in the implementation of the strategy through a midterm review in 2027 and a final report in 2031. That is all, sir. Thank you. Thank you, Rapporteur. Then I'd like to open the floor for additional comments. Should you have any additional comments to make? Anything else? No request. Canada has the floor.
Gracias. Just to know if the Secretariat has received our proposed changes. Nothing major, just clarification and would you like us to go, shall I go through them? Perfect.
Sí.
No problem. So very briefly, first proposed changes to OP2, changing the, to ensure consistency, we prefer the use of agreed language pursuant to Article 12 of the International Covenant on Economic, Social, and Cultural Rights. So using that same language, adding support the right to the enjoyment of the highest attainable standard of physical and mental health, instead of ensure that everyone has the opportunity to enjoy the highest possible level of health. So really using the standard language from the covenant as our first suggestion. Second recommendation, OP2B, replace the word care with the word services. So for scaling up community-based mental health services to ensure that resources are proportionate, etc. So again, using services to encompass treatment, promotion, maintenance, etc., as opposed to care. OPC, using the word institutionalization instead of long stay mental institution. Again, this is alignment with language already being used in Strategic Line Action 2 of the strategy, again for consistency purposes. And finally, OP2D, removing the words from early childhood throughout the life course, noting that throughout the life course implies and applies to early childhood. Again, mostly clarification. Thank you, President, for the opportunity.
Bueno, entonces, sí, claro. Entonces, teniendo en cuenta.
Then, bearing in mind what Canada just read, Canada is not a member of the committee. We need a member of the committee, as such, to be able to support what Canada is saying for this proposal to go through. I repeat, any member of the committee supports what was just read out and proposed by Canada. Brazil. Mr. President, I understand that Argentina and I wish to support this proposal? Perfect. Instead of one, we get two. That's good. And the U.S. as well. So you want to take the floor? You want to say something? Please go ahead. Give us a few minutes just to go through this. Is that okay?
Sí, de acuerdo. Ahora lo que corresponde.
Very well. So what we have next when faced with this situation is that the governing body's office will include these changes into the corresponding languages. And then once again, it will be brought back to the executive committee. So this means that governing body's office will work on this document, will include it in the different languages, and then as soon as it's ready, either later today or tomorrow, it will be brought back for discussion at this session of the executive committee. Any problem here? I don't have any problem here in the back of me. Good. That's good. So let us proceed. Let us move on to the next item. 7.1. 7.1, update on the COVID-19 pandemic in the region of the Americas. I bring it to the attention of the council, of the committee. The president says council, but it is a committee. Document 172 Inf 1. And I invite Dr. Marcos Espinal, acting Assistant Director of the Pan American Sanitary Bureau, and Dr. Duarte, Director of the Emergency Department of the Sanitary Bureau, the Pan American Sanitary Bureau, to please come up to the head table to introduce this agenda item. Who goes first?
El más joven es el primero.
The youngest goes first. Microphone for Dr. Espinal, please.
Technology. Thank you, Mr. President. We will have a combined presentation, and the first few slides will be shown by Dr. Ugarte, and then I will continue, if you allow us, Mr. President.
Seguro.
Gracias.
For sure, yes.
Mr. President, Director, delegates, it's a great pleasure to give a presentation on the update on the COVID-19 pandemic in the region of the Americas. Fortunately, we've seen a decrease of in reported cases and deaths driven by the high population level immunity from infection, vaccination, consistent virulence of variants, and improved clinical care management. But the data suggests that the virus has not stabilized into a predictable pattern of evolution, and more variants are expected yet. SARS-CoV-2 sequences deposited in the Global Initiative on Sharing All Influenza Data decreased by 34% compared to 2022. That shows that there is a decline in surveillance and sequencing increases of the risk of bias in sublineage prevalence estimates. And this represents a challenge in identifying new emerging lineage or variants. So we are, although it is not anymore a public health emergency of international concern, most of the countries are still dealing with COVID-19 and other diseases, respiratory diseases, as we've seen, particularly in South America. And currently, Chile is facing a sharp increase of syncytial respiratory virus outbreak, particularly in small children. And we are, Chile is responding very well to the challenging emergency. At the same time, we also highlight the solidarity of several countries in the Americas to support Chile in this regard. During this period, PAHO, When I say PAHO, it is the member states, but also the Secretariat. And I would like to highlight the importance of the incident management system in PAHO, particularly at the country level and also at the regional level. And you see in the picture one of the persons that was in charge of the PAHO's strategic stockpile in Panama, who unfortunately died during the pandemic and complying with his obligations. But during that period, we sent more than 593 shipments to 37 countries. 330 of them were related to masks and gloves. And we also sent hundreds of, or millions of gowns and face shields. And you can see that more than 31 laboratories corresponding to 28 countries participate in the COVID-19 genomic surveillance regional network. That is unique. This is the only region that has such a network, and it is the result of the joint collaboration between member states and the Secretariat very early in the response to COVID-19. It was March 2020 when several missions were sent to the member states to enable the countries to detect the new virus. And several laboratories were able to do that using a protocol that was used in Europe at that moment. And that is one of the special progress that we made, and now we expanded that network to 31 laboratories from 28 countries. We also performed more than 400 regional and national trainings to strengthen response capacities. And those trainings were face-to-face, and many of them were also through webinars and online training. But as you know, in several cases, some of the new equipment that was sent to the countries needed extra support to operate those equipment. So the experts on those equipment were also linked to the national laboratories or to the hospitals, so they can use, for example, oxygen concentrators, laboratory equipment, etc. And that was even the equipment were fixed remotely. So those are the type of training that we did also during the pandemic. More than 300 publications, including public health guidelines, were produced during that period, and more than 22,000 professionals trained in infection prevention and control, and more than 43 million COVID-19 diagnostic tests were delivered to 39 countries and territories. In total, you see, more than 300 million were spent in diagnostic tests, PPEs, and medicines, and to protect more than 40 million people through PAHO's strategic fund. There are several lessons learned from the COVID-19. We call it lessons learned, although most of the evidence is still on the making. And I would like to emphasize that because not all the countries have made the after-action reviews or interaction reviews yet. But in general, at the regional level, we saw the importance of epidemic intelligence and integrated surveillance, particularly for respiratory viruses. And this integration is one way forward to rapidly detect and respond and control outbreaks. That is happening, for example, in the case of the syncytial respiratory virus and other viruses that may increase the number of cases in the Americas. The Public Health and Research Laboratories Network is also another lessons learned. Most of the development in this network has been through the huge exchange between the experts in the Americas, experts in the European region, and also experts inside the countries. Because one thing is, of course, having the equipment. The other part is to use those equipment to do a proper testing, but also locating the patients and sharing information across the health systems, and also the interpretation of the results. And that has been done through that networking. And that networking is currently being used to train more experts from several countries. Several of the countries that are in the executive committee have requested additional training for their staff, and the organization is organizing those trainings with the support also of member states that do have stronger capacity on laboratory research and networking. Resilient health systems is not just a lemma, or what's the word I say, a say. It is a reality in many countries. Many countries strengthen their capacity on health systems beyond the health services. And many of those health services, particularly the Caribbean, that were implementing the Smart Hospitals initiative, were used as vaccination centers, but also they continue to operate during emergencies and are self-sufficient. And several of those aspects are also inserted in the resilient health systems. The other lesson to be learned is the regional mechanism for vaccine production and delivery. And our director took bold decisions to implement this lesson in the Americas through different and innovative approaches, because our region suffered the most in relation with the availability of critical supplies at the beginning of the pandemic and during the entire first year of the pandemic. And if it was not because of the regional strategic stockpile, many of the healthcare workers at the beginning of the pandemic would be without protective equipment. Fortunately, we had that, but in limited amounts. Just as a comparison, at the global level, the Americas received around 1 to 2% of all the critical supplies that were distributed by WHO worldwide. And lastly, the human and animal environment interface has been critical. And we are seeing increasingly clear that this relation between animal and human interface and environmental interface is crucial, and that is part of another initiative that is being implemented in the Americas, in PAHO particularly, through the One Health approach, with interventions of many entities inside PAHO, and also working with several partners in the Americas. So the way forward, preparedness and resilient health systems and services through three main areas: the surveillance and integrated genomic surveillance in One Health, the health systems and services based on primary health care, with the primary health care approach. Just to emphasize, the primary health care is like a priority health care, not necessarily the first level of care. And many of the people that go to health systems not necessarily go to the health posts or health centers. Many countries, they go directly to hospitals. And they may need, at that point of entry, a primary healthcare approach. And that's the way that we are looking at this component. And then the expanded immunization programs. Unfortunately, in the last several years, we had a challenge to maintain and increase the immunization programs. That's another process that we have. So through emergency procedures updated based on lessons learned, flexible public health measures, health logistics and networks to rapidly deploy staff and goods. And that's something that is being implemented. And on early May, the Emergency Committee on COVID-19 met for the last time, and they decided that the COVID-19 pandemic was not anymore a public health emergency of international concern, but they recommended the Director General of WHO to implement temporary recommendations from the IHR, from the IHR Emergency Committee. And there are the integrated COVID-19 vaccination into life course vaccination programs. All the immunization programs, expanded programs of immunization. Maintain surveillance of mortality, morbidity, and variant that will be shared with WHO, and leverage the global influenza surveillance and response systems and support the establishment of the WHO Global Laboratory Network, that is COVINET in WHO and COVIGEN for the Americas. And strengthen regulatory authorities to support long-term authorization and use of vaccines, diagnostics, and therapeutics. And also update respiratory pathogen pandemic preparedness plans, incorporating learnings from national and subnational after action reviews. I would like to emphasize this part because only a transparent, honest review of what went wrong, what went good, what were the adjustments that we must do inside the countries will help us be better prepared for the next emergency. And also adapt risk communication and community engagement and infodemic management strategies and interventions. We have been discussing this around these topics during this executive committee. In this case, was crucial. And even though risk communication and community engagement was identified as crucial during the Ebola response in West Africa, still, it seems that we didn't learn enough to implement these components. And also, the Emergency Committee recommended to continue to lift COVID-19 international travel-related health measures, particularly based on risk assessment. And then to continue to support research, because only through new knowledge and shared knowledge, we will be better off of this pandemic and the next ones. Thank you.
Thank you, Ciro. What I'm going to do now is just to give you 6 slides on what was the impact of the pandemic on the routine programs and other important areas of health in the region. Before that, let me just show you how the region did in terms of vaccination. So 2.1 billion vaccine doses has been administered in the Americas. So you can see that as both sides of the glass, 70%, that's okay, but we didn't reach 80 or 90% as we all wanted. And we understand why, a lot of issues related to vaccine hesitancy, the fact that those vaccines were made in record time. And so, but that tells us that we need to do probably better education, better information, better communication to our countries, better engagement of civil societies for future pandemics, because we expect other pandemics and we expect there will be new vaccines and so on. We can say we did well, but we can say we need to do better in terms of vaccine. But it's 71% cumulative. This is data as of 16 June 2023. And the other point I wanted to make is that more and more we are seeing less countries reporting. Probably we have a little more than 2.1 million doses. As of 16 June, we only have 23 countries reporting, of 51 that were reporting during the pandemic. So important to know those facts, meaning that we probably still, the pandemic hasn't finished, as Ciro was, it's not an international emergency health concern or blah, 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 but it's still making impact in the people. And we have seen peaks, ups and downs of the pandemic. So important to know that we still need to continue doing much better work in terms of making sure that people get the vaccines. This is a very important one, where we can see how the extent and magnitude of the services, health system services and programs were impacted. The 4 boxes, 3 in blue at the top and 3 in red and 1 in blue, these are representing the WHO Pulse Survey, la encuesta del pulso de la OMS, which have in different times since the last quarter of 2020, and then it went 2021, and then the blue one is the last survey between November 2022 and January 2023. So it's fairly recent. And as you can see there, still 67% of the countries still are reporting disruption to at least one service. So we're still not out of the pandemic completely. Well, you can see 25% of the countries is the average percentage of services disrupted within country. So there are areas within countries that are more impacted and the services are not yet there. Important for us to know that we still need to continue working in the recovery. This is going to take time. It's not a 100-meter race. It's not going to be tomorrow. So important to know that. And to the right, you can see countries reporting disruptions, elective surgeries, 47%, appointment with a specialist, 42%, and so on. First level of care, 40% disruption. And this is just back to the end of last year, beginning of this year. So we still have a problem. But if we go to the next one, this is a more detailed granularity shown here. The 3 colors represent the level of disruption within the countries, 5 to 25% disrupted, more than 50% disrupted the services in red. And you can still, all these categories, we have red categories. So severe disruption in several countries, 8%, 4%, and so on. When you see the total average, for instance, for care for other people is 43% of the countries, non-communicable diseases 31%, and so on. So immunization 28%, still struggling. No, we are not yet there, out of the pandemic. So we better continue paying attention, even if it's closed as an international emergency or. Having said this, and as Ciro was saying, there is a new administration in PAHO, there is a new director in PAHO, and you all heard his inaugural speech where he told us about 5 new pillars of his administration, continuing in some of the issues of our previous director, Dr. Etienne. Completion of pandemic control, implementations of lessons learned during the pandemic, recovery. And this is what we still need to work very hard. We need to recover from the impacts of the pandemic on priority health programs, on improving, building resilience health systems based on primary health care. So, and this is not going to be easy. The next few years will be tough on that. And out of these 5 pillars, we already started working in several initiatives. And this is my last slide. I wanted to leave you with the way forward. First one, maintaining lessons, expanding new technologies, and continue to adapt technical cooperation to recover and hopefully to achieve the SDGs. 2030. It's just there, around the corner. Optimizing tools and initiatives, the PAHO Virtual Campus for capacity building, the strategic fund and the revolving fund, and as you know, in the new organigram of the organization, the new structure launched by Dr. Barbosa when he took over 1st of February, and a new structure came in place 1st of April. The 2 funds are now led in one entity. It's called the Regional Revolving Funds, and led by one director. So to find synergies, to find areas of convergence and to work together to make sure we take both funds to the best level and to provide the best service to the countries and to make sure the vaccines, the commodities, the diagnostics, the medicines are at the primary health care available to the people. We need to leverage external opportunities for recovery. There is the pandemic fund that the World Bank and you know, some of the countries here are board members and I believe, if my memory doesn't fail me, that more than 40 proposals were submitted from these regions here, no? Yeah, about 40, something like that. So, finger crossed, because all this, we want this funding to go to the region and to the countries of the region. The equity issue, I don't need to talk about it. Dr. Barbosa spoke this morning. We all know it. You know, a few days ago, we had a meeting with the Canadian delegation about equity, a very good meeting on equity and gender equity and other areas of equity, ethnicity, and so on, to discuss the way forward, because this is, again, the most inequitable region in the world, the Americas. Great wealth economically, but not well distributed. Digitalization and innovation, and PAHO is rolling out that with the countries. We just, last year, as probably you remembered, it was 2 years ago, the One Health approach in PAHO was endorsed as a policy. But we also have the pandemic treaty, the IHR revision, and Ciro spoke about that we need to make sure our voice, the voice of the countries, is heard at the global level also. Two interprogrammatic initiatives Dr. Barbosa mentioned today in his morning address about integrating NCDs into primary health care and advancing elimination of more than 30 diseases, advanced and expand immunization, and building a resilient health system on primary health care. And we all know about the human resources for health and the initiative launched also with the United States back in the Summit of the Americas and so on. So interesting times, lots of challenges, but hope. And as you know, this region is very resilient, and this region has great human beings and great expertise, and no doubt that we all will do it together to make sure we recover and we implement better systems for the health of the people of the region. With that, I thank you. Thank you. Gracias, Señor Presidente.
Thank you. I thank Doctors Ugarte and Espinal. We should move forward, but we're not going to. We're going to take a short break. Then when we come back, we will resume this item, 7.1, and then move on to 7.2 and 7.3 if time allows. Break until 4.
Hola, buenas tardes. Vamos a...
A very good afternoon. We are about to launch into the last session of today's meeting, and so, Chair, please go ahead. Thank you. So, moving right along, as they say, after a little coffee or tea, a little more beefed up, and we were hearing statements, you will recall, from different delegations who wish to intervene on the question of update on the COVID-19 pandemic in the region of the Americas, item 7.1. I offer the floor again. Argentina is the fastest on the block. Go right ahead. Well, we're on it, Chair. Thank you. We're very grateful for the statements that we've heard from Dr. Ciro Espinal and Marcos. Thank you very much. We are, of course, very, very aware of the importance of continuing to apply measures to reduce transmission and reduce mortality and morbidity associated with COVID-19. WHO has already stated, we have heard and know, that COVID is no longer a danger of international health magnitude. However, well, we know the difficulties we survived, or barely, when there was insufficient medications available, and everything that we had to do, therefore, to ensure that we did our part to limit the spread of the prevention and of the disease. I'd like to say what we've done. Since October of 22, we included, as of 6 years of age, pediatric vaccination. From the beginning of 22, we included vigilance for COVID within the overall acute respiratory illnesses of possible viral origin also. Argentina is also part of the new network for surveillance of pathogens and CPRs of the WHO, with a view to improving the systems that will allow us to better collect and analyze the samples that are taken and have a better sense of what the public health situation is, and once we have information, share it appropriately. The idea is to continue to strengthen our response capacity for vigilance and at the lab level, and that we are doing. With respect to this hub work of WHO, we are working with WHO, and we're working with Synergium, the Albran, and numbers of other groups to help us increase the possibility of boosting vaccination in the Americas and the production of the medications. With regard to the pandemic, our country is working on a national plan for response to health crises within the national framework, and of course that is, parceled out among different elements. The capacity for response at the national and regional level, of course, remains key. Thank you. Thank you. Argentina. Brazil has the floor. Thank you, Chair. We, too, would like to express the Secretariat for the report that has been presented, which, quite frankly, was quite broad, encompassing, and useful with regard to this situation in the Americas and what we've just lived. Now, I'd like to raise two questions, if I may. One to give some thought to later on, and another having to do with the request for information and clarification. One has to do with paragraph 4 of the document, where the mention is that in 2023, it says between the detection of the first case, that was 6.6 million and 63,000 deaths as of 3 June 2023, making up 20% and 29% of cases and deaths that were reported globally, respectively. I'm talking about that first sentence in paragraph 4. But there is a disconnect, it seems to me, between those two sets of figures. And I'd like to ask the Secretariat, how come there's such a difference as between the numbers of deaths compared to the number of cases? The one seems awfully much higher than it might have been. That's the first question I'd appreciate having a clarification to. The other one starts with paragraph 21 of the document, in which it is said in pertinent part that in September 2021, it goes on, and the vaccines and other health technology in the Americas to foster research and incentivize the development and manufacturing of essential and strategic health technologies, et cetera, et cetera. I'm talking about the middle of paragraph 21. That is something that Brazil thought was very well thought out. To make clear those two aspects, we thought was an excellent idea, because this showed that we could operate on the basis of fairly stable information. People weren't hiking expectations unreasonably. Then under 31, I should say, where we're talking about the future, there is no mention of the regional platform, nor is there any mention with regard to local manufacturing. Now, I understand that we're not expecting to make a decision on these issues on the basis of a general report, but it just raises the question in my mind: why was the question of that regional platform flat deleted from this? It isn't there that I can read. And I'm just curious as to why that might have been. Maybe the Secretariat could look at this, and maybe we should have some kind of register about all these things, so that nobody goes back and says, well, wait a minute, what were the priorities of the organization at the day? It might be good to list them, I'm wondering. Thank you very much. Brazil has the chair. The United States has the floor.
Thank you, Mr. Vice President. The United States thanks PAHO for the report on updates on the COVID-19 pandemic in the region. Monitoring the impact of COVID-19 and the effectiveness of prevention and control strategies remains a public health priority, and this report underscores the critical importance of public health capacities and collaboration. As a region, we now find ourselves at a different point in the COVID-19 response, with more tools and approaches than ever before to better protect ourselves and our communities, and growing knowledge on longer-term impacts of COVID. We find ourselves tackling lingering effects of the pandemic, including on our health and care systems and with individuals and communities, and need to continue to work together by sharing best practices, leveraging our shared experiences and capacities where possible, and coming together around regional and global solutions that will strengthen our collective capacity to prevent, prepare for, respond to, and recover from such emergencies in the future. We encourage PAHO member states to continue implementing its strategic and technical guidance to develop and apply impactful strategies to strengthen the recovery from the COVID-19 pandemic. And the United States will continue working with partners in the region to continue the recovery from the pandemic. Thank you.
Gracias a la delegada de Estados Unidos.
Thank you very much, United States. Appreciate that input. I'm happy to recognize Cuba. Thank you, Chair. We are, above all, very grateful for this report. Now, as to vaccination against COVID-19, I can tell you, and with some pride, that through June 2023, more than 10.7 million first doses, more than 10.7 million. That's 95% and plus of our population that have been vaccinated. More than 10 million have their entire vaccination schedule done. That's 90.8% of the total population and 98% of the vaccinated citizens. Now, of the 5 lines that are looked at in this document and they're under consultation, we wanted to pay particular attention to 2. Strategic line 2, the epidemiological one. We in Cuba have been able to detect cases in opportune and timely manner detecting vulnerabilities in specific populations. Vigilance, surveillance of COVID-19 is very, very much a part of the Sentinel system that we have against the flu and other acute respiratory diseases. And so the notification, identification and notification of this for, again, serious flu or other serious respiratory illnesses are all immediately communicated. There is vigilance at a territorial level. We have people enough on that task, and the epidemiological studies show Pedro Jurí, the particular institute that follows this, is on it week by week. On line 5, in terms of lending support to COVID-19 actions, we have a system of health which, as you may know, is 100% free, including immunization, under which from 2021 our national vaccines were made available. We kept a very close track of the epidemiological situation and particularly any possible adverse effect that might have arisen. Thank you very much. Thank you. Cuba, says the chair. Next up, El Salvador. Thank you. We would like to express particular appreciation to PAHO for the enormous support that was offered us. We were one of the very first, you know, that reached a significant 50% initially, and above that, 50% people vaccinated. We were named one of the champions of the work against COVID. Now, as to resilience, we are very interested in this as a country, and I should hope as a region. When I say this, in sustainability, like medical oxygen available and personal equipment that, as we know, was so scant at the beginning, and medical equipment. Also to strengthen the lab network. We, as a country, have a genomic sequencing, and that is very much thanks to the support we've received from PAHO from day one. Cannot thank you enough for that. We also, and one of the slides picked this up, by the way, mentions that the vaccination against COVID should be a part of the regular vaccination list of things that we need to take off. And we think for that reason it should be included in the rotating fund. Thank you. Thank you, El Salvador. Mexico has the floor. Thank you. Mexico also wishes to express its thanks for the presentations. Surely one of the lessons learned from this health crisis is the following: reiterating the fact that health is a human right. And on that basis, it is our duty, is it not, to do what we're just doing, which is to continue in close touch with countries and keep a debate going so that we can set up, all of us, universal coverage and clear debate and understanding of what's happening. In Mexico, we unfortunately had some deaths, but we very quickly realized that that was an opportunity to do what I've just mentioned, to put up the right to health as the human right it is, and to take up a multilateral, multi-pronged approach to achieve that. Dr. Barbosa has been immensely helpful from the beginning, and we are pleased to see him where he is. Thank you. Thank you very much, Mexico. Canada has the floor.
Gracias. Just to take a quick opportunity to thank you for this presentation and to note that we commend PAHO really for being the first WHO regional office to conduct an external evaluation and to share it. And we look forward to that on Wednesday. And it really speaks to the much appreciated commitment to transparency and accountability. So thank you.
Thank you so much, Canada. Does any other delegation wish to speak at this time? If that is not the case, aside from the countries? Yes, go ahead, sir. Good afternoon. Excuse me, says the chair. Just a minute. Let me see where we are. We now give the floor to the representative of the American Academy on Health and Environmental Issues for a statement. It's EDIS by its acronym, a non-state actor with official relations with PAHO. I am very sure that you are a wonderful connection for WHO. Go right ahead. For PAHO, the interpreter corrects herself. Thank you very much, Chair, distinguished heads of the Executive Committee. I'm Jose Luis Ingles. I'm the president of the Inter-American Association of Health and Environmental Engineering over November 22, November 24. The association I represent here, this American Association of Health and Environmental Issues, kicked off its support in 1948, almost at the same time as PAHO. And this is thanks to engineer Bill Borma, to whom, in fact, PAHO itself suggested that the association be created. We have 24 chapters, 75 years of existence. Maybe you've counted it out, and a very multidisciplinary group of people who are working in both of these aspects to bolster sustainable health in the region and to assist the Americas in this regard through two concrete actions. One, early alarm for pandemics coming from residual waters. We have taken up as a permanent task the control and tracking of residual waters in order to be very sure that we have the appropriate epidemiological information in that regard. Different countries in the region have served to develop national plans, early vigilance, again on the basis of residual water. And this, we believe, is what will help us spot pandemics earlier in Latin America and the Caribbean. Brazil, Argentina, Peru, Mexico, and others, and some in the Caribbean have already availed themselves of these services. But what I'm saying here is that we need to broaden the net and have more people benefit, more countries benefit. Now, it's important also that the Americas have sufficient drinking water, potable water. The pandemic has shown this conclusively. However, we only know the information really in a valid form from 7 countries in terms of the quality and the quantity of the services in question, and on the basis of actions that are taken in those places. We've got to do more to diagnose the situation in the rest. On the basis of the small sample we have, however, we can only see that there are abysmal gaps in what we still need to know. We need reconstruction of old installments so that true drinking water can be worthy of the name and, in fact, be a source of health and not the means by which who knows how many other diseases are going to be spread. Thank you very much, distinguished head of the Executive Committee. Thank you. Thank you for that statement. Does anyone else wish to take the floor? If that is not the case, then I am pleased to give the floor to Drs. Espinal and Duarte for their respective comments.
Gracias, señor presidente.
Thank you, Mr. President, and I thank Argentina, Brazil, the United States, Cuba, El Salvador, Mexico, Canada, and also the delegate of IRIS for all their comments. We are very interested to hear about countries' developments, and in one of the slides I presented, we do show support provided for the development and production of equipment and materials in the region. So that is a key component of the work we do, and it is shown in that way. But the original document was very long, and we had to cut back so that we could make the presentation here. But the background document, or the reference document, and the report in its full version does contain the information about priorities. Now, turning to the question about the rise in mortality related to COVID-19, let me say that the winter season for 2022-23 saw a very large number of cases and also deaths. About 5,000 deaths were reported per week. And this is from 23 January to March. During the same time and in preceding months, we had seen an increase in the massive use of rapid antigen tests, which were administered primarily at home. And many of those cases were not even reported to the surveillance systems. This means that the cases that were not reported were not counted as part of the mortality rate you see in the report, and that's why there is that disconnect between the number of deaths and the number of cases for prior periods. But you've asked a very important question. If cases are not being reported, then it is very likely that we may be missing an opportunity to identify an increase in cases at some place and time. So that is why we have said that it's very important to maintain surveillance efforts and not just look at severe cases, cases that are hospitalized or that result in death. Many cases have stopped reporting cases of patients that are hospitalized, especially after WHO declared an end to the international public health event. And that is why many of the challenges are still with us. And we hope that if proper surveillance efforts are sustained, we will not have to deal with another sudden rise in cases, which could also result in an increased number of deaths. We've also realized that it's important to also engage the national emergency systems. They should be involved in intersectoral planning efforts. I think this is one of the most important lessons we've learned with the pandemic. The national risk management and emergency preparedness systems should be one of the pillars of the work we do. And turning to including the COVID-19 vaccine in the regular vaccination programs, I would like to have Dr. Espinal take that question, if I may. Thank you, Ciro. We appreciate the comments from Argentina, Brazil, El Salvador, the United States, Cuba, Canada, and AIDES. I will start with El Salvador's question about vaccines. We will be starting to do a demand analysis under the revolving fund to include COVID-19 vaccines under the fund in order to ensure their availability. Perhaps the director of the revolving fund, the executive manager, Dr. Cornejo, can also speak with you offline, but we will be speaking with all countries in order to assess the demand for the vaccine and include it. As of 2024, all those vaccines should be included. Vaccines are undergoing changes. Constantly, they're being improved. Argentina also made an important point about vaccine manufacture. I think that is something, it's a must in the region. It is a top priority. We need a platform to manufacture vaccines, drugs, and commodities. There are two centers, by the way, one in Brazil also one in Argentina and another one in El Salvador for PPEs for certification. And there's also one in Colombia. And we do have a committee supporting the platform. So again, this is a must. There's no going back. We learned from the pandemic that we cannot rely on countries that are far away, not to mention names, of course, but we do have the capacity to do this locally through South-South, North-South, and three-way cooperation. I thank the United States and Cuba for sharing their information. I do think it is important to stress the importance of continuity. Continuity as regards strategies, not only to control and respond to a pandemic like COVID, but also to consider other potential pandemics, and that is part of ongoing global negotiations. I think we have a meeting next week here, actually 10 to 12 July. It's a regional meeting which Dr. Ugarte is organizing. It's a collaborative effort, and all countries will attend to discuss IHR, the review, and also the pandemic treaty. So we urge you to participate. We've already been in touch with the country representatives so that they can send in the names of participants. I believe there was a meeting already. I believe the meeting will be in Spanish. And I do thank Canada for the comments about evaluation. We do want to encourage transparency. A corporate group has been identified under Dr. Ugarte's lead, and the idea is to have all entities within the organization to have a plan to respond to the recommendations made in the evaluation. Some things were done very well, that is true, but there's always room for improvement, and that's the idea, to have PAHO staff have a chance to comment, and those plans will also be shared with member states. And so that is a work in progress. And to Edis, thank you very much. We've been working with you for many years, and we appreciate your proposals. We think they're quite pertinent. The issue of water and sanitation in the region has a long way to go. Waste disposal, human waste disposal, is an essential component, and it's important to look at this and look at the connection with health. So we need to get to that 6%, which is the benchmark for investments in health. And I do think water and sanitation is tantamount to health. So we do need to consider mechanisms that are part of health and others that are not as part of this effort. So thank you again, and we will be taking note and will encourage our climate change and environmental determinants unit to consider your proposals and to perhaps have a discussion with you. Thank you to Drs. Ugarte and Espinal, and I would ask the director if he would like to take the floor. Yes, President, thank you very much, and thank you to all member states for sharing information about the efforts taking place at the national level and also for making suggestions to update our agenda. I have a few quick things to say, and I'll start by recognizing and congratulating each and every country for efforts deployed to respond adequately to the pandemic. It was not our standard public health emergency. It was the most far-reaching and dramatic public health emergency we've seen this century. And it's had economic, social, and political fallout in all countries of the region. So I do think it is important to commend all countries for everything they did. Secondly, I think it's also important for us to recommend that we carry out an evaluation of what happened during that pandemic. A real-life event gives us more information than any simulation we can carry out. So I think this is a unique opportunity to look at what happened during the pandemic, what worked, what do we need to address, what do we need to change, so that in the event of another public health emergency, we will be better equipped to respond. Also, I'd like to thank the United States, Spain, and Canada for their support, since all three are here. The assistance and donations they provided, vaccines and resources, were extremely helpful to bolster the organization's efforts and also to facilitate access to vaccines in our countries. Because at a given point in time, despite the fact that we were at the epicenter of the pandemic, we did not have equal access to vaccines, whether through direct or indirect procurement using mechanisms such as COVAX. So it's important to recognize the support you and other partners afforded us, enabling us to have a stronger response. Then turning to the point made about an external evaluation.
That I have committed to implement it to increase the transparency. So this is the first one that we are publishing, but all other external evaluations that the PAHO performs in the future will be available widely. I think that this is important. Sometimes these evaluations, like the audit reports, can find something that we are not happy with them, but this is the way that I think that we lead the organization, provide more transparency and be accountable to our member states. And I think that it also serves as an encouragement that the countries can perform their own external evaluation in order to improve their response. So thank you very much for this very important comments that you have made. And I do believe that with the implementation of this report that the Assistant Director mentioned, now we have this group that is reviewing very carefully, establish a plan of action with a timeline, with responsible, and my commitment is to report to the governing bodies the implementation of these recommendations that we received from this external committee. Thank you. Gracias, señor presidente.
Thank you very much. Thank you, Director. I would like to add that the report will be reflected in the committee's final report. We move on to the next item, which is item 7.2, report on strategic issues between PAHO and WHO. I draw the committee's attention to document CE 172 INF 2 and invite Mr. Ronnie Massa, Director of the Planning Department, the Planning, Budget, and Administration Department, to join us at the head table. Thank you very much. Good afternoon.
Director, distinguished delegates, colleagues in health. This report provides an update to member states on high-level strategic issues and opportunities related to PAHO's engagement with WHO. The report focuses on leadership and governance, as well as accountability and transparency issues, building on member states' recommendations and requests since we presented the first report in 2017. I'd like to highlight on the key role our member states and the region have played and continue to play in shaping the future global health emergency architecture and the governance of WHO. The PAHO Secretariat has been supporting our member states directly in collaboration with the capitals and through delegations in Geneva through the Group of the Americas, or GRUA. With information sharing sessions, and a special session was held in March this year with the convening of a face-to-face regional meeting on the Intergovernmental Negotiating Body, or INB, to ensure their meaningful participation in this process. As a follow-up to your request during the Health Assembly, the World Health Assembly last month, for additional consultation and support from the PAHO Secretariat, a second face-to-face regional meeting will be held from 10 to 13 July here in this hotel, to serve as a forum for member states to continue engaging in discussions prior to the sixth meeting of the INB, scheduled in Geneva on the 17th to the 21st of July. That will be the fourth meeting of the working group on the IHR review as well, which will be held later that month, 24 to 28 July, also to be held in Geneva at the WHO headquarters. Member states have also been actively engaged in the Agile Member States Task Force on strengthening WHO's budgetary, programmatic, and financing governance, advocating for enhancing accountability, transparency, oversight, and efficiency that must go hand in hand with strengthening WHO's governance and sustainable financing. Turning to program budget and financing matters, the approved WHO program budget for 2024-2025 includes a 1.2% increase above the 2022-23 program budget for the region. This is thanks in large part to your sustained advocacy and increasing collaboration that we have sustained with member states and the WHO Secretariat. The prioritization exercise conducted with member states was indeed an instrumental input to inform WHO's proposed program budget for 2024-25. And we were happy to see that the WHO Secretariat took your input and suggestions to build a program budget that responds more in line with the country's and the region's priorities. We would like to thank you, the member states, for your continuous tremendous response and engagement in completing such prioritization exercise, which also serve to inform the PAHO program budget, therefore creating efficiencies for both processes. At the World Health Assembly last month, member states also approved the decision to establish the WHO replenishment financing mechanism to increase flexible funding to implement the general program of work and thereby enable the WHO Secretariat to better respond to member states' priorities and address chronically underfunded priority programs. This will be implemented through investment rounds beginning next year. In anticipation for the first investment round, the WHO Secretariat was requested to hold consultations on the development of the 14th General Program of Work proposed for the year 2025 to 2028. Considering the strategic nature of the General Program of Work, an opportunity for our member states to influence the definition of global health priorities, results framework, and strategies based on country and regional priorities, we encourage the member states to actively participate in these consultations with a focus on seeking opportunities to improve alignment between global, regional, and country priorities. Such consultations are expected to take place between August to December of this year. I am pleased to note the increased financing to the region from WHO for the current program budget 2022-23. Thanks again to your ongoing advocacy for a more equitable distribution of WHO funds across all regions. As of 31 May 2023, the region had received $172.3 million, or 59% funding for the base programs budget. Of this amount, about $122 million came from WHO flexible funds and about $51 million from voluntary contributions. I am pleased to note that about $16 million additional in flexible funds and $8 million in thematic voluntary contributions, which are more flexible voluntary contributions that can be assigned to priority programs, have come to the region. However, the region remains the least funded among WHO major offices. This situation requires ongoing collaboration with you, the member states, and the WHO Secretariat. Indeed, as highlighted earlier in this session, the increase of the budget envelope for the Americas for 2024 from WHO and the increased commitment to pay additional assessed contributions from member states to WHO provides additional opportunities for you and us to continue advocating for commensurate funding and more equitable distribution of funds to the region. Underpinning all this work, the PAHO Secretariat's executive management and our technical networks continue to pursue strategic collaboration and engagement with member states and the WHO Secretariat. We participate in high-level exchanges on strategic and technical matters to ensure that the region is represented and to ensure that our priority areas are always present on the different WHO agendas and fora. The Secretariat of PAHO will continue to provide and to facilitate relevant information sessions, briefings, and consultations as necessary or as requested by you, our member states, to ensure that the global health agenda matters benefit from the Americas' regional and country-level contributions. I thank you for your attention.
Gracias.
Thank you, Director. I would now offer the floor to the Chair of the Subcommittee on Program Budget Administration to report on the next item. Thank you very much. I will read the summary of the report SPBA 17/FR, which is already posted in all 3 official languages. We'll confirm that the subcommittee reviewed a prior version of the report on this item, providing updated information about opportunities and strategic issues, high-level issues related with a collaboration between PAHO and WHO. In the report, there was information about ongoing consultations on key world issues related to health emergencies, including within the working group on amendments to the international health regulations and the intergovernmental negotiating body tasked with drafting and negotiating a new international instrument on pandemic prevention, preparedness, and response. The subcommittee expressed thanks to the Bureau for its efforts to keep member states apprised of the progress of the various global processes and enable them to participate in global and regional consultations to build regional consensus on the issues under discussion. The importance of ensuring transparent, inclusive, consensus-based processes that respect the needs of all member states and take account of their working hours and languages was emphasized. The importance of ensuring participation by microstates was also emphasized. The subcommittee applauded the Bureau's efforts to increase the sharing of relevant information and best practices from the region with WHO. It was considered important to show how the region's work contributes to the attainment of global health results. In that connection, the PAHO revolving fund for access to vaccines was seen as an international best practice. It was suggested that as WHO is at a historic juncture that will entail making decisions that are crucial to its future and that will have repercussions at the regional level, future reports should include an analysis of the impact of global decisions on the region, together with the identified risks and other recommendations, clear recommendations that will help member states in determining their national positions. Thank you, Mr. President. That concludes my report on this item. Thank you. I now offer the floor to the plenary for discussion. United States has the floor.
Thank you. The United States thanks the Secretariat for the report on strategic issues between PAHO and WHO and commends the organization for its continuous efforts to improve governance, accountability, transparency, and collaboration in the region and to connect these efforts across WHO's levels. We continue to appreciate PAHO's close partnership with WHO and member states to strengthen WHO's preparedness and response to health emergencies, including PAHO's efforts building consensus on these issues in the region and providing member states with the ability, forum, and opportunity to meet and discuss both IHR and INB issues. Reflecting on WHO's efforts to strengthen country-level impact, the United States supports and encourages PAHO's close collaboration with WHO and member states to strengthen the regional offices and their work at the country level. And we look forward to future updates about the work of the Action for Results Group and other similar actions to deepen country-level impact and to share cross-region learnings. Thank you.
Gracias a la delegada de Estados Unidos.
I thank the representative for the United States. Brazil has the floor next.
Muito obrigado, senhor presidente. O Brasil
Thank you very much, Chair. Very grateful for the report we've just heard, and congratulations to PAHO for what it has done under this most strategic issue. We are very pleased to have these consultations at the regional level that were carried out at that last Pan American Health Organization meeting of the office and the new instruments that have been drawn up for the region. And, of course, the exchanges as to how we can do better and share information more promptly. The first in-person meeting was in March of this year, and we considered it of particular importance for the national authorities who were present, and really led to setting up a good groundwork for the next regional meeting. We take good note of the next one that's being planned, and certainly plan to be proactive. This platform is essential, we believe, for regional coordination because it will have to do with the fourth meeting of the WGIR and others. We hope that there will be increased dialogue among the states as a result of these interactions, and that will be reflected in Geneva. What we bring to Geneva from the regional standpoint, as everybody here knows, is essential for us to stand on a firmer ground for the world as a whole. Thank you. Thank you very much, Brazil. Argentina has the floor. Thank you. Let me begin by thanking the Bureau for the excellent support that has been offered as we have organized our various regional consultations. The Americas has a very unique position in this regard as regards strengthening of WHO onto emergency issues, and we know a lot about leadership and governance. That is why we consider that the role of the United States in that group has been particularly useful, and that too of Brazil as well in the other meeting. We think that our input to the report that WHO looks at is essential, and we hope that PAHO will continue to hold these dialogues that will bring us all abreast of what the different processes are that are being held in Geneva, because keeping us up to scratch with what's happening in Geneva is immensely helpful. And the second in-person meeting to be held in July will certainly be an opportunity for us to try to put our heads together and bring ourselves to common positions, we hope, vis-a-vis meetings still ahead in June and in July. These processes matter, and it matters, too, to be abreast and to have PAHO with us so that we know what the story is and where we stand and what positions we can best take is most appreciated. We are very, very determined to continue in the road of a more proactive positioning. We know it'll make a difference, and we know how critical it is for us to know what we want to say so that nothing stands in the way of taking a position in timely fashion. The pro tem chairmanship of Mercosur, which we ended just last week, has given us certainly a very firsthand understanding of what all of this means. And we know that we made a difference to improving general consensus in the region and to raise the voice of the region. Thank you. Thank you, Argentina. Chile is next. Thank you. Chile is particularly grateful for the PAHO proposal on modification to the international health regulation and the new pandemic treaty. My country believes that those are two issues that are central to how we focus on the formulation of international policy. And it is critical in that regard that all of us take part. And so thanks to this organization for organizing the next meeting that will allow us to do this. I understand it'll be held here in Washington sometime in the middle of July, TBD. Now, both of these documents and the international tools that go with them, especially the international health regulations, probably need to be tweaked. However, both the regulation and the treaty of access to complementary tools and issues that will facilitate the global response need to be considered as intertwined as they are, need to be considered separately. Let's not mix them up. And we are willing to lend our head and shoulder to anything you think will make a difference, because we'd like to, in as much as we were one of the first delegations, as you know, to push in this direction. One of the so-called friends of the treaty were very, very determined to stay in the mix. Thank you, Chile. No one else seems to be asking for the floor. That would tell me that there's nothing further to be said just at this moment. So I'm pleased to give the floor yet again to Mr. Ronnie Maza for further comment. Thank you, sir, and thank you to the United States, Chile, Brazil, and Argentina for the various comments and questions. With your agreement, sir, I will simply point out that since many of these comments have spoken to preparation for any new treaty, I think Dr. Ciro Ugarte, would be a wonderful speaker on the subject, if you would be so kind as to give him the floor after I'm done. But let me just say flat out, we are very, very open to continuing consultations, as we have done, in preparing all of the fora of WHO. And you can tell us where we can do better. We're open to that. And the ERG, the results-oriented group, is also, we know, most valuable. But remember that the increase in 20% quotas that you all approved in the program budget, I think, speaks for itself. 60% of that increase, which is about $120 million, would be earmarked for building capacity in the countries. And that stems directly from the initiative that Dr. Jarvis has pointed out, and in turn, how we are working with WHO to figure out where the vacuums are, how we can fill those gaps, and how we can move forward on a stronger footing as we wish to make best use possible of any funds that we get from WHO. So it's all seamless, and we will look to have that seem so in our next report. Let me also take the opportunity while I'm at it to encourage you to step up at the next working group where the program will be defined. It's a very important definition for the next 5 years at WHO. And that necessarily will have an impact on priorities in this region. So they're not divorced from each other. So please get involved. This general program will indeed also have, I say again, an impact for the next general program here at PAHO. We will stay tuned, and we ask that you do the same. So it ain't over. If you can pass it over to Dr. Ugarte now, that would be great. Thank you. Indeed. Dr. Ugarte, says the chair, the director of emergency. Ciro, please go ahead. Thank you. Thank you, Mr. Chairman, Mr. Director, distinguished delegates of the member states. Thank you very much for your various comments and input. The consultancy meetings in Geneva with the permanent missions very often are not friendly for the capitals here. Why? Because they take place at 2 and 3 a.m. It's the morning over there. What can we do? But El Salvador, Brazil, Argentina, etc., are interested, and sometimes they have been invited 1 or 2 days before these sessions happen in Geneva, sometimes with complex presentations where suddenly they're asked for their opinion. Now, the missions in Geneva simply don't have the time to interact with their respective capitals as they would wish to do. And in the absence of specific comments and a better understanding of what's going on, what is it going to be? The comments that we hear from this side are pro forma or the best they can do, but they're not informed, literally. But they should be. And that is why, as we review the matter, such as it is, that this director that we now have decided to convene that in-person meeting here in Washington to discuss the intergovernmental organization in question. And I think the very fact of convening the foreign affairs ministries as well as the health ministries in Geneva and here have really yielded results, not just with regards to emergencies, but above and beyond the issue of emergencies. But the emergency program of WHO, we do know, is broader and broader. The position of the countries last time, the last pandemic, were very clear as regards consultancy. And as a result of this, the international architecture for emergencies that was put to the Assembly was based on postponing approval and moving that consideration over to the permanent group of the consultative group of WHO for it to deal with it. Well, as you well know, that is the governance of WHO as regards emergencies. So it belongs to the member states. But that is a proactive forum that helps us regionally. And our director, on that basis, and you already have pointed this out, has convened on 10, 11, and 12 July, probably in this very room, so that we can discuss all of this with you all. I would merely underscore what several of the member states of the Executive Committee have pointed out, and that is that one of the objectives has been to find a regional consensus on priority issues for the region. Now, we've come some long way in that regard. El Salvador, numbers of others have talked about the rotating fund and experience we have had that may be of use to the rest of the world. But there are operational issues that have come a fur peace in our region. And a global mechanism might well have repercussions for this region. The point was made, well, okay, the contribution to the Americas, but what about the impact of global decisions on us? So it's a complex issue, and we are looking at it as best we can. And I would just end picking up on the comment my friend and colleague Ronnie Maza said. It is critical that we move forward in that dialogue alongside the work of our organization. This is essential. I cannot underscore it enough. Essential to what we're doing and what we're trying to achieve with the international health regulation. Both of these instruments indeed have to be within a regional agreement. That is what Ronnie Maza was addressing from a strategic standpoint. Thank you very much. Very good. Thank you, sir. Dr. Ciro Ugarte. We have that now. And let me now give the floor to our director. Thank you.
I think that everybody is tired. So first I want to take out the very constant.
The interpreter points out the mic is cutting out Dr. Jarvis's mic.
Two issues. The first one is about the comment from the U.S. government. I think that I briefly mentioned, but let me maybe reiterate that we are totally aligned that it's very important to reinforce the country presence. Of course, that we have in this region a situation that is significantly different from other WHO regions, because in some countries, in other regions, unfortunately, the country office, WHO country office, is like a diplomatic representation only. In our region, we have countries, in almost every country in this region, we have a country office that is able to provide technical cooperation. But when we review our presence in the countries, we see some inequalities among countries that we should have a similar presence. For instance, among the key countries that were, the definition about the key countries was made by our member states during the planning process that approved the strategic plan. So with our own resources, we are already trying to provide a more equitable presence among the key countries. But we are also working with WHO in order to have the allocation of these funds to AMRO-PAHO based on the evaluation that was made by WHO. But as I mentioned, we asked them, and all the other regional directors asked the same flexibility, because they used an indicator to make 5 categories of country. And clearly, for instance, in one country in Africa that is in the middle of a civil war, probably they need 2 officers for safety and security. In our region, probably don't need. In big countries like in Nigeria, they need a deputy representative. In a small country in our region that has a centralized health system, probably we don't need a deputy representative. It's better to use this resource to strengthen the technical team. So we are, in this dialogue, we have already sent the first proposal following the WHO ARG instructions. We sent them the first proposal. I think that is like, this first proposal is like a wish list, because for those who are not familiar, they have 5 categories, and they asked to address the 4 categories, B, C, D, and E. So it's much more funds than are really available. So probably, I think that at the end of the day, we will try to cover only D and E categories. But they asked for the B, C, D, and E. We send this information, and we are in this dialogue. I personally think that's a very important movement from Geneva. I commended our DG effort to strengthen this co-presence, but we need to provide the best efficient use possible to these funds. For this reason that we are asking for this flexibility to use the knowledge that we have for the country situation, respecting the ceilings that will be allocated in order to strengthen our presence in the region. At the same time, we fully agree that this around the 120 million should be directed to the countries, so we don't want 1 cent of this being utilized in the regional, at the regional level. This money should go 100% to our member states in a very transparent way. So we are waiting for the response from WHO, but we are in a close coordination with them. And again, thank you for our member states for also highlighting during the discussion about the increasing of the access contribution to ask for a share or at least a more equitable distribution of these funds for the Americas. Deixe-me cambiar para espanhol solo para dizer da importância desse debate, né? Nosso diretor, Ciro Gatti, já hizo mención de cómo ha sido importante esse debate. Eu creio que todo o debate sobre o novo Regulamento Sanitário Internacional, o novo instrumento, são uma oportunidade única que temos.
This is a unique opportunity that we have, particularly when it concerns countries that don't have a very strong presence in Geneva or no presence in Geneva. Those countries necessarily feel rather isolated and on the sidelines of that very important exchange. And so we would hope that the decision might be postponed to 2025. On the basis of the experience I have garnered, I can only say that we have to hop on the opportunity to push for changes that we know would be good in the international sanitary health regulations. And it has to be to at least 24. If we don't manage to postpone it, we're going to end up with a great deal more trouble than we would wish. Every country, you may understand, and understandably, wants to preserve, to safeguard its sovereignty. We get that. At the same time, we all want to increase transparency in communications, in the response mechanism, in being equitable. And equitable, I mean, with vaccines and other equipment, I should say, that is necessary. We've been through that, we know. So it's quite necessary that we safeguard the country's ability to build a consensus so that we are all standing more firmly the next time any pandemic comes up. We don't know when it'll happen or what it'll be, but we know it'll happen. So it's important to be ready. I'm very proud, really I am, to say that our region is the one out there and pushing for the importance of sharing information with the member states. We've had a number of meetings virtually. I think the first one in person, yes, that already happened, and we're working on the second one. And for the second one, as Dr. Ugarte already pointed out, we are inviting 2 people from the capital, 1 from the Ministry of Health and 1 from Foreign Affairs, not just health, but Foreign Affairs. Why? Because the missions, as you know, are obviously under the aegis of their respective foreign affairs, so you got to bring them in too. We need Washington, we need Geneva, and 2 people from the capital. That puts us in a much firmer position to make those 2 or 3 days of debate a lot more fluid as we seek consensus. So please, please, please take this most seriously and come along. Come and participate and make the difference. Now, we also hope at that time to build a consensus looking forward to the 2024 World Health Assembly. Who knows, there may be a joint position of the Americas. Wouldn't that be great on some consensus issue? It would certainly, I think, help to gird up the solidarity amongst us all. So those are the points that I wanted to share with you this afternoon, recognizing, of course, that it is a very uplifting thing to see how seriously each and every one of you are taking the need to keep abreast, to know what the documents are saying, and to be there, what the IHR says and what the new regulations are. Thank you very much, sir. Thank you. Thank you very much, Mr. Director. We appreciate that overview. This debate that we've just held on the subject will, of course, be reflected in the final report. Ladies and gentlemen, that wraps up our consideration of this item. That's 7.2, but that also wraps up the day. We will then tomorrow, starting at 9 a.m., with the issues that were listed in our listing for the Tuesday, the 27th, 5.2, 5.3, 5.4, 3.7, 3.8, and 5.5. All of them are on our docket for tomorrow morning. After lunch, we'll see where we stand and what the issues might be that we'll want to give a little more attention to, depending on how far we get in the morning. So let me simply, at this point, thank you most sincerely for your active participation. I don't know what the director thinks, but I think today has been a stellar day. Everybody's been active, both those countries that are effective members and everybody else. And so, to end, let me, of course, give the floor to the Assistant Director.
Just a reminder, delegates, please, that at 6 p.m. this evening, our director, Dr. Jarvis Barbosa, will host a reception in honor of the participants of the Executive Committee. This reception will take place in the Colonnade Room, which is on the same floor as the lobby. So Colonnade Room, same floor as the lobby. And see you all at 6 o'clock.
Vamos a cerrarlo.
The meeting stands adjourned.